This meeting is being recorded.
السلام عليكم.
Assalamu alaikum, Dr. Hani.
How are you guys?
Alhamdulillah.
Okay, today inshallah we will continue for system examination. We started yesterday joint examination and the 3 stations of system examination. So vascular, peripheral vascular, and upper and lower neurology. So we are talking about system examination. The most common in the exam, it will be joint examination because they said injured patient. So most likely will be joint, not system, okay? But anyway, you have to be ready for any possibility. We don't know what exactly in their minds, okay? So we still have maxillofacial, eye examination, ear examination, thyroid examination, cranial nerve examination, respiratory examination, cardiovascular examination, abdomen examination, maybe abdomen here, maybe normal examination, or maybe vaginal examination. So it will be by manual examination, by hand, and a speculum examination. So if you understand eye examination and the ear examination, it will help you in maxillofacial. If you will understand the eye examination, it will help you in thyroid examination. If you understand also eye examination, it will help you in cranial nerve examination. Respiratory and the cardiovascular, it's unlikely in the exam. Abdomen, unlikely in the exam. BV examination, it's not too much, okay? So the most common, number 1, joint. Number 2, system. If they will give you system, it will be like cranial, thyroid. Number 1, cranial. Number 2, thyroid. Number 3, eye or ear. Number 4, maxillofacial examination. Okay. But again, the most important, joint examination. We finished yesterday, neck, back, shoulder, hand, hip, knee. Very, very important in the exam. The most common in the exam, hand and shoulder. Hand and shoulder. Knee. Okay, back, hip. So by arrangement like that. Okay, so we have Dr. Abdul Rab, Dr. Ahmed Al-Amin, Dr. Raji. Who else, guys, happy to practice? You can raise your hand. Okay. So we will start by Dr. Abdul Rab. How are you, Dr. Abdul Rab? Guys, can you hear me?
Yes, Dr. Hani.
Yes, doctor.
Okay. So, Dr. Abdul Rab. Your
Sir,
mic.
yeah, sir, continue, sir. I will join some time, sir, please.
Okay, okay.
I'm just
So,
reaching home.
Okay, okay. Dr. Ahmed Al-Amin.
Yes, Dr. Hani, I'm here.
Okay. Are you happy to do this station?
Yes, yes.
Okay. So I will give you 30 seconds to prepare yourself. Okay, you can start.
Okay, I'm going to wash my hand, put on my PPE. Hello, I'm Dr. Ahmed Lamin, ED Registrar. May I confirm your name and age, please?
Yeah, Fathi, 40 years.
Nice to meet you, Mr. Fathi. Today I've been informed that you're having a problem with your left eye. Is this correct?
Yeah,
I'm so sorry to hear that. Are you having any pain or discomfort? You wish me to offer you any pain medications right now?
no, there is no pain in my eye.
Okay, Mr. Fathi. So today I've been asked to do an examination for your eye. Okay, this will involve me have a look at your eye, testing your vision, and also ask you to do some movement with the and special test. Would that be okay with you?
Okay,
Okay, do you mind if a nurse attend with us?
it's okay.
Okay, so first let me check your vital signs. Now, Mr. Fathi, just a quick question. Did the loss of vision or the decreased vision that you're having, was it sudden or was it gradual?
Sudden,
Okay, is it a complete loss of vision, double vision, blurring of vision, or how you describe it?
complete loss of vision.
Okay, have you, do you still have it till now or is it gone?
Yeah, still no.
Okay, have you noticed any like flashes of light or floaters in the field of vision?
No, no.
Okay, Mr. Fathi, let us proceed for the examination. I'm going to wash my hand, put on my PPE. I need to prepare my equipment. I will need an ophthalmoscope. I will need a Snell chart, near vision chart, the Shahara chart. That's for now, and a pinhole device, please. Okay, general look at in the beginning. I'm going to look for any prescription with the patient, for any visual aids, for any other aids with the patient. Okay. Now, Mr. Fathi, I'm going to do an inspection, a simple inspection for your eyes. I'm going to sit in front of you. Okay. So first of all, I'm going to check for the eyebrows, for any loss of the outer eyebrows. I'm going to look for the periorbital tissue for any swellings, for any edema. I'm going to check for the eyelids for any swelling, any drooping, any laceration or any problem. I'm going to look for the eyelashes for the loss of eyelashes. I'm going to check for the conjunctiva for any congestion or foreign body in the sclera or conjunctiva. I'm going to look for the cornea for the presence of any corneal abrasion or laceration. And I'm going to check the pupils for the size, symmetry, and shape. Okay, Mr. Fathi, I would like to test your vision now. Can you look at the chart there? Do you wear any glasses? Okay, can you cover your right eye and look with your left eye and read for me the last line? Excellent, thank you very much. Can you do that with the other eye? Thank you very much, Mr. Fathi. Now I would like to test the field of your vision. Okay, I need you to close your right eye. I'm going to mirror you, close my opposite eye for you. Okay, now Mr. Fathi, do you see any distortion in my face? Okay, thank you. Now, can you please follow my finger from the center? Tell me when it disappeared to the periphery. Okay, tell me when it disappeared. Tell me when it disappeared. Tell me when it disappeared. Thank you, Mr. Fathi. I'm going to repeat this with my other eye. Now, with the other eye. Now, Mr. Fathi, I want to check the reaction of your light of your eyes to the light. I need to dim the light. I'm going to use a torch. Okay, Mr. Fathi, I'm going to bring the torch close to your eye, checking the pupillary reflex in one eye, then consensus in the other eye. I'm going to repeat it on the other side, and then I'm going to do the swinging test. Thank you very much, Mr. Fathi. Now I need you to look, check your eyes for how they accommodate to near object. Can you look behind me, please? Now, can you look at my finger? Yes, thank you very much, Mr. Fathi. Now, Mr. Fathi, I would like to check for the movement of the muscles of your eyes. I need you to look directly into my face and to follow my finger. Do not move your head and tell me whenever you feel any pain or you're feeling any double vision. Okay, can you follow my finger? Okay, up and down. Can you follow my finger? Up and down. I'm going to look also for any nystagmus or any lagging. Okay, thank you very much, Mr. Fathi. Now I would like to do an examination of the back of your eye. I'm going to use this machine. It's called the ophthalmoscope. So I'm going to dim the light. I'm going to hold the ophthalmoscope. First of all, I'm going to look for the red lift.
Done.
Ophthalmoscope is done. Okay, Mr. Fathi, I have completed my examination for now, and thank you very much. And in order to complete it, I will need to check the pressure of the eye by manometer. I would like to do examination by
okay, this is the examination of fundoscope.
Okay, Mr. Fathi, according to the examination, I'm sorry to tell you that one of the main vessels of the eye is blocked by a blood clot. We call it central retinal artery occlusion. I need to keep you in the observation room, do a full examination. I will call the ophthalmologist urgently. Also, I'm going to do some procedures for you, like massaging of the eye. I'm going to give you some medication in order to help move the clot from its place, like Diamox, nitroglycerin, and Timolol eye drops. If this sounds reasonable for you, Mr. Fathi. Okay, so let us proceed for that. And thank you very much. I take off my PPE, wash my hands.
Okay, excellent, Dr. Ahmed. You still have 40 seconds. Okay, well done. So eye examination, it means you will start from the beginning. So inspection. Also, if you want to do palpation, no worries. It will be for tenderness or anything. So inspection here, you will inspect the eyebrow and also eyelashes. After that, conjunctiva, the cornea, the pupil, and compare both eyes. After that, if you want to do palpation, no worries, because it's eye examination. So you will check for any tenderness and also for any looking at the eyes of the patient, so tenderness. And also if you want to do for crepitus, you will check for any crepitus. Here regarding if he said trauma, you have to check for any ecchymosis. Okay, so this for inspection and palpation. After that, you will do visual field and visual acuity. So visual acuity, you ask the patient for the purpose of the time, you can verbalize to the examiner. Ideally, I need to examine both eyes, but for the purpose of the time, I will examine the affected eye. Okay, so can you look at the Snellen chart? Can you tell me the lowest line? Thank you. Don't waste the time. You have to verbalize to the actor. Thank you. It means already this test was done. Okay, so he will tell you about the last line, or maybe he will not talk, so no need to waste the time. After that, you will do the test of visual field. So you will ask the patient to cover one eye, and you will cover the same eye. Okay, the mirror. So you will use 2 fingers. If you see my finger, tell me yes. So here you can do 4 times. Okay, so from center to peripheral, from central to peripheral, or from peripheral to central. It's a logic from peripheral to central. Okay, until he see. Once he see, done. Okay, can you see my finger? 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 And then you will ask him to cover the other eye, and you will cover also the other eye, and you will do the same. So it's called peripheral visual field. After that, H test. H test for which nerve, guys?
3 nerves.
Trochlear, oculomotor, abducens.
Third, fourth, and sixth, right? Third,
Yes.
oculomotor, fourth, trochlear, and sixth, so it means abducing nerve. Okay, so here, H test. Put your finger here, ask the patient, fix your head and follow my finger by your eyes. In H test, verbalize to the examiner like that. And start from the middle, like that, straight to the right. After that, up, then down. After that, start from the middle again, straight to the left. After that, up, then down. Okay, so ask the patient if you have pain or blurring of vision, tell me. You have to warn him before the test. Don't warn him after the test. No benefit after the test. So I will do H test for your eyes movement for third, fourth, sixth nerves. Okay, verbalize to the examiner. Tell me if you have pain or blurring of vision or double vision. And I will, you as a physician, I will check for nystagmus. Okay, so the first test for what, guys? First test.
Optic nerve. Visual acuity.
Yeah, visual acuity and the visual field. So you are talking about optic and also oculomotor. Okay.
Yeah.
So after that, you will do ocular motility for third, fourth, and sixth cranial nerves. Okay. After that, pupillary reflexes. For which nerve, guys?
Optic and oculomotor.
Excellent. Optic and oculomotor. Very excellent. Okay. Did you mention that, Dr. Ahmed? Dr. Ahmed Al-Amin. Dr. Ahmed Al-Amin, are you still there? Okay. So you have to mention the name of the nerve, why you are doing this test. It will be better for you to get high marks. Okay. So here you will shine the light reflex, the light in one eye and check the pupil in the same eye. After that, shine the light in the same eye again, but this time you will check for the other eye. So the patient has problem in the, for example, in the right eye. So ideally, you will check both eyes, but for the purpose of the time, you will check only for the right eye. So I will shine the light in the right eye. I will check the pupil in the same eye. I will repeat again. This is how to verbalize to the examiner. I will repeat again. And this time, I will check the pupil in the other eye. So the first one is direct. The second one is consensual. Pupillary reflexes. Okay. After that, swinging. So you will put your hand on the nose between both eyes and do swinging. You will shine here and here, here and here, and check for pupils in both eyes. Okay. So what is this test, guys? What is called?
For RAPD.
Afferent pupillary defect.
Yeah.
Afferent pupillary relative afferent pupillary defect. Okay, rapid. So you will put hand like that here and do swing. So it means you will shine here, after that shine here, after that shine here, after that shine here. Okay. After that, accommodation reflex. You will ask the patient to look straight. Can you look straight? And look at the wall. After that, look at my finger. Your finger should be close to his nose. And you will check for what, guys? Convergence and constriction.
Constriction.
Yeah. So you will verbalize to the patient like that. Can you look straight? I will do accommodation reflex test. Can you look straight and look at the wall? And after that, can you look at my finger close to your nose? I will look for convergence and constriction. Thank you. Okay. This time I will use this device fundoscope. The examiner will say done. Okay, done. So they will show you any slide. So here, what is the diagnosis in this one, guys?
Papilledema.
Papilledema.
Okay, papilledema. So what is the management?
Urgent refer.
Intraocular pressure. Raise the weight.
Papilledema. Yeah, treat the cause and like control the blood pressure and then refer to ophthalmologist.
Okay, so this one, you can refer to ophthalmologist or even neuro, no worries, because it's resident intracranial pressure. So here, the most important, diagnose and manage. So you have to give the patient mannitol or hypertonic saline and treat the underlying cause if known. And this one, what is the diagnosis?
Central
Central
retinal
venal vein occlusion.
or veins.
Okay, excellent. So it's a vein, right? So here, hemorrhage or pallor?
Hemorrhage.
Hemorrhage.
Hemorrhage. So in general, the difference between artery problem or vein problem, whatever in leg, in eye, or any part of the body, the artery will cause pallor because the artery is responsible for blood supply. But the vein will cause swelling, will cause redness, will cause hotness, okay? Different than the artery. So we can see here hemorrhages. So hemorrhages here all over the retina or only part?
All
All
over.
over.
All over.
Okay, so it means it's a central retinal vein. What about this one? Hemorrhage or
Branch
pallor?
retinal vein occlusion.
Yeah, so we can see part only. Can you see the difference between this one and this one? This one only part. So it's a branch of vein, okay? Branch of central vein. So what is the management in vein?
Read refer.
Refer to ophthalmologist, okay? Don't do anything, just refer now, okay? What is this diagnosis?
Central artery.
Artery,
Artery.
because pallor, there is no hemorrhage here, right? Okay, so here regarding the vessels, it's attenuated, choroidal spot, okay, and bare retina. Why is this one only red? Why not pallor?
It
Occlusion.
receives blood supply from choroidal vessels.
Yes, so it receives blood from another source, right?
Yes.
Okay, that's why it's not pallor. It's not affected by the central retinal artery. That's why it's still red. Okay, so as Dr. Ahmed said, gentle ocular massage. After that, you will give medicine like acetazolamide IV, nitroglycerin sublingual, and what else, guys?
Timolol.
Timolol eye drops.
Drops.
Yeah, excellent, Dr. Ahmed, amazing.
Dr.
You are. Let me finish, please. So
Okay.
Dr. Ahmed controlled his tone, controlled his time. Also, is communicating with the patient, is verbalizing to the examiner. But the only one point, you have to mention this test for which nerve, okay? You are testing the eye. Testing the eye, it means inspection from outside. After that, palpation. After that, examination. Examination here, you are examining the nerves of the eye, okay? You are examining everything from outside to inside, okay? But the fundoscope, you have no time for fundoscope, okay? Next one, Dr. Raji.
Dr. Hani, one thing I want to ask.
Yeah,
For example, if we are doing exam, we have to ask the examiner that we are doing the superficial examination and deep examination. For superficial, I will put the fluorescent drops to see anterior of the eye. And I will put the mydiotic drop for the back of the eye because it will dilate and I can see properly.
this when you are using a fundoscope.
Yeah, at that time.
If the examiner did not say done, you have to proceed.
Okay.
And sometimes I told you, sometimes the examiner is not concentrating with you. So you have to ask him and confirm. Already we know, all of us, we know, it's not common for the examiner to let you to do fundoscopy in eye examination. You have no time. But if you will say, if you will verbalize, I will do fundoscopy, and the examiner did not say done, maybe he's not concentrating. So confirm. Would you like me to continue with fundoscopy? Okay, so you have to confirm. No worries if you ask him clearly. Maybe he's not concentrating. I have one station before mini mental stat exam, and I ask the examiner, I want to present my finding. He's not concentrating with me. I confirm with him again, and then he said, okay, you can. So sometimes he is busy with checking your marks on the computer. He's clicking the mouse with computer. Okay. So anyway, once you proceed with fundoscopy, you can use anterior segment, after that red reflex, after that posterior segment. So you can use fluorescein eye drops in the anterior segment for cornea. After that, red reflex. After that, mydriatic drops in posterior segment. This will be only on fundoscopy. No need to mention in eye examination. Okay, well done. Dr. Raji?
Yes, sir.
Okay. You have 30 seconds.
Okay.
You can start.
Okay. I'll wash my hands. Hello, I'm Dr. Rajalakshmi, ED Register. Can I confirm your name and age, please?
Yeah, Jasmine, 30 years.
Nice to meet you, Mr. Gassman. I have been asked to examine your ear. Would that be okay with you?
Okay.
Can you tell me how can I help you today?
Yeah, I have hearing a problem in my left ear, doctor.
Okay, I'm sorry to hear that. For that, I need you to examine your ear, as I said before, which involves look, feel, and do some special test on your ear. Would that be okay with you?
Okay.
Okay, thank you. Now I'm going to start the examination. Mr. Gassman, can you smile for me?
Okay.
Okay, now I'm going to look for the right ear. I'm going to see if there are any wound, any laceration, any swelling, any deformity.
Which ear, doctor?
I'll start from the right ear.
Okay.
I'm looking for any deformity, any scars, any wound, any laceration, any discharge. And I'll also look behind the ear and in front of the ear. And I want to look on the left ear for any laceration, any scar, any deformity, any swelling, any discharge.
Okay.
Thank you. Now I'm going to feel your ear. I'm going to looking for any tenderness and also look at the patient eyes. I'm palpating the preauricular area for any tenderness, and I'm palpating the post-auricular area on the left side, and I'm repeat the same on the right side. Thank you. Now I'm going to do some special test, which is using this instrument called otoscope. Now I'm going to hold the otoscope like a pen. For right ear, I'll start from the right ear. I'll hold the otoscope in the right hand. Now I'm going to nearby the patient. For that, I'm going to keep my hand on your chin, and I'll going to lift your ear upward, backward to straighten the ear canal. I'm looking for any ulcers, redness, any discharge in the ear canal, and looking for tympanic membrane for any redness or perforation. Thank you. I want to do the same on the left ear. Thank you. I have completed. Now I'm going to do some whispering test. For that, I'm going to stand behind you. Can you close your right ear, please? 99. Can you if you hear that, can you repeat that? Can you close on your close your left ear? 99. Thank you. I have completed. Now, okay, thank you. I have completed my examination. Are you sorry, I need to do a tunic fork test. Mr. Gasman, I'm going to place this tunic fork on your forehead. Can you hear it? Can you tell me which ear is loudest, or is it equal on the both side? Okay, now I'm going to do the Rennie's test. For that, I'm going to place this tunic fork on your right ear, behind the ear. When you hear it, say yes. When you stop, say stop. Okay, when it stop, I'm going to place this in front of the ear. Can you hear it? Thank you. Now I'm going to do the same on the other side to checking for any air conduction or bone conduction. Air conduction is more than bone conduction is normal. Thank you. I have completed my examination. Are you comfortable now?
Okay, the patient can hear the sound loudest on Weber test
Okay. In which
on
left ear?
on the affected ear,
Okay.
and the bone conduction. What do you expect? The bone conduction or air conduction will be more?
Bone conduction is more than air conduction if it is abnormal.
Okay, this is the diagnosis.
Okay.
So
Thank you.
what do you think regarding this
There
slide?
is a perforation, which may be a traumatic.
Okay,
Traumatic perforation. In
what is the
tympanic.
management?
Thank you, Mr. Ashman. I have completed my examination. From the examination, I can find there is a perforation in your tympanic membrane, which, and I have a good news, which is self-limiting. For that, I advise you to don't swim in the swim and don't poke anything into your ear. And you will be in a follow-up. And if you have any worsening symptoms or any fever, any discharge, you can come back at any time. That be okay with you?
Okay.
Thank you.
Okay, thank you, Dr. Raji.
Thank you.
What do you think?
Confused, sir.
Okay, it's a very easy and a very short station, because
Yes,
just inspection, palpation, after that otoscope, after that whisper test, after that tuning fork. Very easy and very short. Okay.
Yes.
Yeah. So you can expect this patient trauma or not trauma. Did you ask the patient, do you have trauma?
No, sir, I didn't ask. I started the examination before that.
So any examination in the exam, an examination station in the exam, you have to ask the patient any trauma.
Okay, sir.
Or Dr. Ahmed Al-Amin also, I wish he asked like that. Any trauma, very important here. Okay.
Okay.
Yeah, because if trauma, you have to expect bleeding and also perforation, and you have to verbalize that to the examiner. Okay. Yeah.
Can I ask, can you tell me more about your symptoms? Like that? Yeah.
So here you did very well regarding inspection. I will look to the ear from outside. I will check for any laceration, any abrasion, any redness, any inflammation. Also in front and behind the ear, the same. After that, I will feel the ear. Here, for the purpose of the time, I will check only the affected ear. Ideally, you have to verbalize to the examiner like that. You don't have time.
Okay.
So first of all, you have to verbalize in front of the examiner. Ideally, I need to check both ears. I should start by the normal ear, but for the purpose of the time, I will examine the affected ear. Okay. So here, start by inspection. After that, palpation. Palpation, you did very well. I will feel the ear from outside. And here, if you mention parts of the ear, it will be better. And I will look at the eyes of the patient for any discomfort. Okay. After that, you will use the otoscope. Did you take consent from the patient for otoscope?
No, sir, I didn't.
No. Did you explain by simple language
Yes, sir, I
according to
have.
the otoscope? So
While doing it, I'm explaining.
yeah, so I need to examine your ear from inside in the ear canal by this device, otoscope. It's not painful. It's not painful.
Okay.
If you feel any discomfort anytime, you can stop me. Okay.
Okay.
So verbalize to the examiner. I will hold by thumb and index like a pen, and my other fingers on the cheek of the patient. Okay. By the other hand, pulling the ear backward and posterior upward to straighten the canal. You did very well in this point. Okay. And you will check for what? You will check the
Internal.
the canal and also the tympanic membrane for what? For any laceration, same. Laceration, redness, inflammation, discharge, okay, perforation of tympanic membrane, bulging of tympanic membrane, okay, or redness. So after that, you finish that. So before you use the otoscope, you have to choose the speculum, okay? So I will choose the adequate speculum according to the age of the patient, okay?
Okay.
Yeah, very important. After that, you will dispose equipment, okay? So here regarding the whisper test, you did very well, but you have to explain the test before the test. Don't explain the test after the test.
Okay.
Not logic, okay? Now I will do whisper test. You have to verbalize to the examiner. In the start, you ask the patient to smile, right?
Yes, sir.
For what? For which nerve?
For facial now.
Okay, why you are keeping secret for yourself?
Okay,
So,
I should tell that. Yes.
yes, the examiner will give you mark. So you have to verbalize to the examiner. Can you smile, please? I want to check facial nerve. Done. Okay. If the patient is smiling very well with symmetrical smiling, it means he has no problem in facial nerve, right?
Yes, sir.
Okay. So after that, you already continue for whisper test. Whisper test, you have to explain by simple language. Okay. So tell him, I will whisper number and tell me this number. Can you close? He will close the normal one or affected one?
We'll start with the normal one.
We mentioned in the start, we will examine only the affected one, right?
Yes, sir.
For example, this is the affected one. So he will close the affected or the normal?
Normal one.
Normal, okay. So can you close the normal one and I will examine the affected one?
Okay.
66. Can you tell me? He will say 66. Done. Clear?
Yes, sir.
Yeah. After that, Weber test. Okay. He has the affected one, for example, in the right. So I will use this toning fork. Don't waste time. Just pretend that you are doing on your knee. Okay. After that, put in forehead. Tell me which ear you feel loudest. He will not talk. Sometimes actors are not professional. If the examiner want to tell you, he will say. So if he will feel loudest in the affected one, it means it's a conductive. It means perforation in the right ear. Okay. After that, I will do the same, but this time behind your ear in the bone. Okay. Tell me if you stop hearing that. Okay. After that, I will put in front of your ear. Tell me if you still hear that. Okay. So here the problem is conductive. Conductive, it means which one will be more bone conduction, more air conduction, or the opposite?
Bone conduction
Bone
is
conduction
air
better.
conduction.
Okay, so you have to, if the examiner give you any abnormality, you have to give him the diagnosis.
Okay.
If the examiner did not talk, you can ask the examiner any finding. Okay, so he will tell you. You can ask the examiner clearly any finding. Okay, so he will tell you. Otherwise, he will show you the slide. So what is the diagnosis here in the slide?
Otitis media.
Otitis media. So it will be give him antibiotic, right?
Yes, sir.
Yeah, and come back if not improving.
Okay.
And this one, what is the diagnosis?
Cholesteatoma.
Cholesteatoma. So tympanic membrane rupture also.
Yes.
Okay, cholesteatoma. This one in the bone or in the brain?
Bone.
On
Oh.
bone.
Bone.
Okay, so this one needs CT scan or MRI?
CT scan.
CT.
Okay, CT scan. What if schwannoma? Schwannoma is bone or brain or brain?
Schwannoma is brain.
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 In the brain. So it's a nerve. So if schwannoma, it will be MRI.
Okay.
Cholesteatoma, it's a CT because involved in the bone. Okay, and this one perforation. We don't know if traumatic or not. Maybe infection, right?
Yes,
You have
sir.
to ask the actor from the start. Any trauma? If yes, okay. So here, whatever traumatic or infection. If infection, you have to give antibiotic, okay, and also keep the ear dry. More than enough to say keep the ear dry. It means avoid swimming, avoid putting anything inside the ear. Okay. Well done, Dr. Raji.
Thank you, sir.
Dr. Hani,
Yes.
we went directly inside, so we have to give some, we have to talk about the ear canal also, that it is blocked, it is clear, there is any swelling ear canal. It can
Yeah,
be
we
there, maybe
mentioned that. We mentioned that. So
okay.
once you put the otoscope, you have to verbalize. I will check the ear canal for any redness, swelling, occlusion, discharge, abrasion, inflammation. Also, I will check for the tympanic membrane for any bulging, redness, perforation, discharge. Okay, yeah. Okay, next station, this one. I think this is your turn, Dr. Tariq. Are you happy to do that?
Yes, Dr. Hani. Okay.
Okay. You have 30 seconds.
I will start.
Okay, start.
I will wash my head and wear PP. Hello, Mr. I am Dr. Tariq, one of the senior doctor in emergency department today. I have been asked that I have to examine you. Can you let me know about what is going on with you?
Yeah, I was in the party and my friend, he pushed me in my right eye.
I'm sorry to hear this one. And do you have any pain? So I will offer a painkiller.
The nurse gave me painkiller.
Do you have any past medical history or any surgical history?
No.
When you last ate and drink?
I cannot remember.
Okay, so I will examine you. It's okay with you?
Okay.
I will ask my sister as a chaperone. It's okay?
Okay.
Okay, my examination will include, I will, first of all, I will inspect, then I will palpate, and I will do some examination that is special examination of your eyes. Is it okay with you?
Okay.
If in between that you have any pain or anything, you can ask me, or if you want to stop, you can stop me. Is it okay with you?
Okay.
Okay, first of all, can you let me know that where is exactly, which eye is affected?
Right eye.
Do you have any bleeding or there is any lacerations? I will examine, I will inspect the patient I will see for the laceration, any bruises, any scar, any any deviation of the eyes, I will check the sclera and I will check the pupil also, and conjunctiva. Is there any redness of the conjunctiva or any laceration any side of the, okay? And after that I will go for the palpation. I will palpate the upper eyelid just, and up forehead. If there is any bruise, I will go for the frontal sinus. I will go to see the sinus of ethmoidal sinus. Then I will go to just only below the eyes. I will palpate here any tenderness, and I will palpate on tenderness at temporomandibular joint, and I will palpate all these areas. And after that, I will see any nose. I will see any trauma in the nose, and I will see any hematoma of the nose as well as, and I will go to see the ear, the right side, and I will examine the ear. There is discharge from there, or any swelling, or any white discharge from ear, and any bruises or any swelling, any part of the ear. And after that, I will go to palpate. I will go for the sensation. I will check the sensation. I will check the sensation of the eyes, front of the fifth cranial nerve, facial nerve. I will check that any weakness, any wrinkles drop. I will ask him that, please, can you see up? If she can see up, I will see that any drop of the wrinkles, and I will ask for the smile, and I will ask for the teeth and cheeks also as well as. Okay, after that, now I will examine, especially I will examine the eye movements, and I will ask the patient that I will examine for the third, fourth, and sixth cranial nerves. And before this one, and I will see that there is any accommodation loss or not. This is for the optic nerve and oculomotor nerve. And I will ask the patient, please, can you look at me just in front of me, and just focus on my eyes. And I just focus on my finger, and I will ask I will bring the finger directly to the near to his eyes, and I will see that there is a convergence and any accommodation, loss of accommodation. I will see for this one and then I will see that movement of the eyes, and for the third, fourth, and sixth cranial nerve. So please, I will just only fix your head and see on my finger, and I will move my finger, just only move your eyes, don't move your head. Is it okay? And I will put just in front, and please look on my nose, and I will move the eyes from the H test, and I will do for the H test complete. And if you feel any diplopia, and if you feel any weakness, and you feel any pain, so please let me know. And after that, I will see the visual acuity of the patient, and I will ask the patient that close his eyes, and I will see from the right temporal, right and down. Then I will bring towards the center, and then I will ask the patient cover the opposite on the left side. Then I will see on the visual acuity of the both sides. Do you feel any pain or any abnormality? Please let me know, diplopia or anything. It's okay with you? Now I will go after that, and I will examine the eyes, and I will examine eye with the fundoscope. And this is it okay with you? This is a fundoscope that I will put the light in your eyes, and this is an instrument to see your front and back of the eyes. Done. Okay. And after that, what I found there is examination is done. So I want to know that there is any tenderness. I feel any tenderness or bruises, and I will go for the X-ray.
Okay, so the X-ray is this one.
Okay, I found that there is a teardrop on the left side of your eyes. It means that there is a orbit of your eyes. There is a fracture fracture of your left orbit eye. For this reason, I will go for your CT scan, and I will call eye specialist as well as, and I might be referred to you for the eye specialist, and I will put the patch on your eyes till he will come, and this is urgent referral. I think there is some trauma, and there is as well as I will refer to orthopedic.
Okay, thank you, Dr. Tan. Thank you. Okay. So I will start from the end. Here,
Yes.
the management plan. What is the diagnosis with you first?
Orbital fracture, infraorbital
Without
fracture.
X-ray, without X-ray, what is the finding in your examination?
He didn't tell me. I do all the H test. No, there is no any pain, just only bruising on the right side. So bruising, maybe there is a fracture. And generally, I examine the patient. There any redness, conjunctival redness,
Yeah.
or there is.
Okay. So from the start, you have to be clear with the patient. You will do examination. You said, I need to do examination. Is that okay with you? Which examination? Examination for what?
Examination of face. Where is the trauma?
You did not mention which
Okay.
examination exactly. Okay.
Okay.
So if you will take consent from any patient, okay, I'm sorry to hear that. Are you comfortable now? Would you like to give you painkiller? No, I took painkiller. Okay, so are you comfortable now? Yeah. Okay. She said already the problem in the right eye. You will do examination for right eye, or you will do examination for maxillofacial. Here it's
No,
not clear. In the exams, you will say do maxillofacial examination. Okay? It will be clear in the exam. So maxillofacial here, what you...
Sorry. So here only I go for eye only.
Yes. Why you will go for eye? Here you went already for eye, for nose, for ear, but you did not explain. Let me organize your approach.
Okay.
So I need to examine your face and your skull. Is that clear?
Okay.
Explain more. So I will examine your eyes, nose, ear, mouth, and the skull. Is that clear, Dr. Tariq?
Yes, sir.
Be simple. Be simple. I will examine eyes, nose, mouth, ears, skull. Done. The examiner here will understand that you know the stage. Clear? If you will say, I will examine your eyes from the start, the examiner will take bad impression about you. Global mark 0. Global mark 0.
Okay.
Okay. Always be clear with yourself. Always be clear with the patient. Be clear with the examiner. Okay. So I am sorry to hear that. I need to examine your face and the skull. I need to examine your eyes, nose. How many now? 1, 2, 3, 4, right?
Yes.
Very easy.
Yeah.
Eyes, nose, mouth, ear, and skull. Okay. So here you will start in examination, inspection first. After that, palpation. So you will do inspection for all, palpation for all. After you finish, you will examine one by one. So you will examine the eyes. It will be special test for eyes, special test for nose, special test for mouth, special test for ears. Okay, so in inspection here, you have anterior, it means the face, and the posterior, it means the scalp, right?
Yeah.
So anterior, and here also you will do inspection. So inspection from anterior, from side, after that from the other side, after that from the scalp, posterior. Clear?
Yes.
Okay. So after that, you will do palpation from anterior, sides, other side, and the posterior. Okay. So let us to finish inspection. I will check, or I will look for the face from anterior. For what, Dr. Tariq?
Any
Laceration?
redness, any bruise, any swelling?
Don't say scars. The patient just has trauma now. He doesn't have trauma 1 month ago. Why you will mention scars? So
Okay.
always be focused. Focus on the more important, relevant information. So
Okay.
I will check for any laceration, any bruises, any bleeding, okay? Any deformity in the face, okay? In the forehead, above the eyes, below the eyes, in the nose, around the mouth. Clear?
Yes.
Yeah, I will check for any conjunctival hemorrhage, or you can say by simple way, any redness or bleeding inside the eye. Okay? Any redness or bleeding inside the mouth. Can you open your mouth? You can check for any bleeding or any deformity inside. So finish inspection of all. After that, inspection for the ear, any laceration, any bruises, any discharge around the ear or inside the ear. After that, the other side, the same. Just verbalize that. I will check in the other side, in the other ear for the same. I will check from behind for any laceration, for any bruises, okay? Any injuries. From above, okay? Above for the same, okay? Done inspection. After that, I will go for palpation. I will feel for any crevitus around the eyes, okay? I will feel for any step deformity, okay, in the forehead, around the eyes, and check for any tenderness, looking at the eyes of the patient. Here, once you mention that, you will feel the patient has facial discomfort. The problem where in the right or left ear, right or left eye?
Right.
Right eye. Once you touch the patient, left eye, no problem. But once you touch the bone, the orbit above and below the right eye, he will show you discomfort. So what you will do, Dr. Tariq, in this situation?
I will stop and give painkiller more or anything.
Yes, how to verbalize? Oh, I'm sorry. Would you like me to give you painkiller? So sorry. Okay. So the patient has tenderness on checking the orbit. Okay. So here you will ask the examiner in inspection any ecchymosis around the right eye. Okay. If he answer you, okay. If he did not answer, you can proceed. Okay. So here the discomfort, it will be easy to catch in the exam. Okay.
Yes.
Okay. So after that, you finished a palpation of the eye. Do for palpation. I will feel the nose. Okay. I will feel the maxilla. Okay. So I'm going from up to down. Okay. I'm going to feel the mandible for any step deformity. Okay. Sorry for that. So I will feel the ear also, the other ear for any step deformity or any tenderness, looking at the eyes of the patient. And also here regarding the scalp. So I will feel any step deformity or any laceration. I finished already inspection and palpation. I will go for a special test. A special test for the eye already we did in the start of the session. Okay. So you will be in front of the patient, check visual acuity, check visual field. After that, accommodation reflexes. Okay. So you check for optic nerve, oculomotor, third, fourth, sixth cranial nerve. Okay. So
Yes.
maybe the patient has injury in the face. That's why you are checking bones, you are checking skin, you are checking nerves. Okay. So nerves here, you check already number 2, optic nerve, 3, oculomotor, fourth, sixth, third, fourth, sixth for movement, eye movement. After that, fifth cranial nerve, it means a trigeminal. Okay, trigeminal, it has 3 nerves, right?
Yes.
Okay, 3 nerves, it means ophthalmic above the eye, and the maxillary below the eye, and the mandibular here, okay, below the lower lip. So can you close your eye if you feel like that? Can you close your eyes and tell me if you feel the problem in the right? So you will start by
left.
Can you feel that? Yes. Can you feel that? Yes. How to verbalize ophthalmic nerve intact? Clear?
Yes.
If you want to say ophthalmic nerve intact, if you want to say supraorbital nerve intact, no worries, same, okay? Because supraorbital is the end of ophthalmic. After that, can you feel that? Maxillary. Can you feel that? No. Did you ask me? No. So, can you feel that? Yes. Can you feel that? No. So, the patient has infraorbital, or you can say maxillary, not intact, below the eye, below the right eye. Okay. Can you feel that? Yes. Can you feel that? Yes. So mandibular nerve intact, or you can say mental nerve intact. Okay. So after that, you can go for nasal speculum. You can check the nose from inside for septal hematoma. Just if even you don't have a speculum, just verbalize like that. I will check your nose with this speculum for any septal hematoma. Thank you. Can you open your mouth? Okay. So you will check for what? In the mouth. Inspection and palpation. In the mouth. Yes. Inside the mouth. Inspection and palpation. So inspection here, it means you will check by your eyes for any loss of teeth and also for any bleeding, any laceration inside the mouth. Done. After that, I will feel. Feel what? For any step deformity inside the mouth. Also, you will feel any moving tooth inside the mouth. And also, you will hold the maxilla by one hand and try to hold the upper teeth by your thumb and index up and down and right and left to check for which fracture, guys?
Leaf out fracture.
Leaf out fracture. Clear? This station?
Yeah. Yes. Yes, okay. Thank you.
Okay. So visual acuity, after that visual field, after that H test. Accommodation, if you want to do, okay. If you don't want to do, okay. It's not a big issue, accommodation. Okay. Here, nasal speculum for septal hematoma, and the ear already we finished. After that, the mouth. Can you open your mouth? So here you will do an inspection first. So you will check for any lost teeth and also for any laceration, any bleeding inside the mouth, also for the tongue, any laceration. After that, you will feel by your hand. So you will feel for any step deformity, any moving tooth, and also you will hold the upper teeth by thumb and the index, and the other hand supporting, and move up and down and right and left to check for Le Fort fracture. Done. The exam done. Okay. So first, you have to order for X-ray. Why you will order for X-ray? Because the patient has loss of sensation below the eye. If not, so no need for X-ray. When you are doing the test for H test, you will ask him if you have pain when you are doing this test. If you have pain and blurring of vision, tell me. He will say, yes, I have pain when I am looking up in the right eye and blurring of vision. That's why you have to order for X-ray. Clear?
Yes.
Yeah. Okay. we will go for the next station, or someone want to do this station again, guys?
Can I do Dr. Hani?
Okay, okay. If you will mention, I will check for tenderness, looking at the eyes of the patient, I will answer you because you cannot see me. Otherwise, in the exam, he will not answer. He will do facial discomfort. Clear, guys? Okay. You can start, Dr. Amir.
Hello, good morning. My name is Dr. Amir. I'm a physician. May I know your name and your age, please?
Yeah, I am Nadia. I am 30 years.
Nice to meet you, Nadia. I've been asked to take some history and do the examination part for your face, which may be involving looking from the front of your face, from both sides, and from the back of your head. Will it be okay with you?
Okay.
Do you mind a nurse attends as a chaperone?
Okay.
Okay. Ms. Nadia, tell me that, do you have right now any pain? I can offer you painkiller.
I took painkiller.
Okay. Are you allergic to any medication?
No.
Are you taking any medications regularly?
No.
Okay. Tell me when you eat last and when you drink last.
I cannot remember.
Can you tell me what happened basically?
Yeah, I was in the party and my friend, he gave me a box in the right eye.
I'm sorry to hear that. Okay. Was this under effect of alcohol or any illicit drugs?
No, we fought, just fought.
Okay. Was there any weapon used?
No, no.
Any involvement of the police?
Doctor, you can proceed for examination.
Okay, sorry. Okay, Ms. Nadia, are you comfortable? I will just look from the front. I will look in the patient right side of the face. I will look for any bruising on around the eye, any ecchymosis, any subconjunctival hemorrhages on the conjunctiva, and I will look for any depression in the zygomatic area, and I will look for any color changes, skin changes in the maxillary area. So I have examined from the front. I will look from the side now, from the right side. I will look for the ear, any bruise, any contusion, particularly behind in the mastoid area. And same, I will repeat for the left side. And now I will look from the back. I will specifically look for the mastoid areas, if there's any bruise, any battle sign. Okay, so Ma'am Nadia, are you comfortable? Now I will be involved, I will be touching it, palpating the area. I'll be touching with my hands. If at any moment, if you're uncomfortable, you can stop me. Okay, so I will be palpating the supraciliary arches of at the level of the eyebrows, and I'll be keep looking into the eyes of the patient. Okay, so I will palpate below the right eye and below the left eye.
Yeah, tenderness here. Tenderness here.
I'm sorry for that. Are you comfortable? Do you need any more painkiller?
No, it's okay.
Okay, so I will palpate now on over the maxillary area. I will palpate over the zygomatic area, and I will also palpate at the mandible on the both sides. Okay, Ma'am Nadia. So now I will move. I will do palpation in the right side, basically at the around the ear. I will just look for any tenderness while pulling the ear upward, and I will look for any tenderness at the mastoid area. Same I will repeat for the left side. Okay, so now I will palpate from the whole scalp, the back of the head, and I will palpate for any step deformity, for any wound, and any blood on my gloves at the end I will see. Okay, so Ma'am Nadia, I will be doing some special test for you, which will be involving examination of your eye. I will be needing to throw some light into your eye. It may be uncomfortable, so please, you can stop me at any moment. Also, I will look inside your nose as well by using a nasal speculum. Also, I will look for inside your mouth as well. Okay, so ma'am, Nadia, can you look please far away? Can you just read on the Snellen chart last line by closing your left eye? Only look with your right eye. Can you read the last line?
There is blurring of vision.
I'm sorry to hear that. Okay, so I will show you the Ishara chart. Yeah, I will show the Ishara chart. Okay, can you just read clearly? Okay, so now I will do the direct light reflex. I will look for the pupillary reaction. Then I will do the consensual light reflex. Okay, then I will look for, I will do now the visual field test. Okay, can you cover the left eye for me, please? Okay, I will do for the superior temporal, the inferior temporal, and then I will do look for the superior nasal side and inferior nasal side.
Doctor,
okay,
can you do eye examination, please?
Sure. Okay. So on conjunctiva, subconjunctival hemorrhages, I will look for. Okay. Now I will have to
eye
look
examination, visual acuity, visual field, and the accommodation and the pupillary reflexes.
Yeah, the pupillary reflexes I did with the direct light reflex by throwing the light into the eye directly.
Visual field. Yeah,
visual field. For the visual field, I told you to please cover your left eye. So with the right eye, I will sit at the same level of you, and I will cover also my right eye. So then I will move my finger in the air. I will stretch my hand above on the temporal side. Okay. Can you see my finger moving?
Thank you, Dr. Amir. Thank you.
My God.
Okay.
Time.
Okay, the time, and also you are not doing the test. Okay, you are not communicating with the patient. Okay, so let me do this station.
Sorry.
Let me do this station.
Can I do it, Dr. Hani?
Okay, Dr. Abdulatif. Okay.
Okay.
And here, please, from the start, explain to the patient. If you will say to the patient from the start, I need to look from anterior sides and posterior. Okay, so it's not allowed for you to touch the patient, right, Dr. Amir?
Yes, Dr. Hani. During the inspection,
from the start, you took consent for looking only. Okay, you said I will look from anterior and both sides and posterior. This is what you mentioned. It means you are not allowed to touch me. You are not allowed to examine my eyes, right? Or you are not allowed to put any device into my ear, my nose, my mouth, right? Okay, so
yeah, I got it. Yes,
you have to explain the test. For example, if you are doing cardiovascular examination, I need to look, feel, and listen. For example, here also, I need to look, touch, and do some special test to your face and the scalp. Okay? Yeah, you have to be clear. The test should be clear. Okay? Otherwise, you will be a liar to the patient. For example, you are doing abdomen examination and suddenly you will do vaginal examination. No, you have to be clear with her. I will do vaginal examination. This involve, explain the test. This involve, I will look, feel, and even you will say, put 2 fingers inside your vagina. So you have to be clear with her. Did you get my point, Dr. Han?
Yeah, boss.
Yeah, okay. So don't surprise the patient. Even, yes, I know this is a facial examination, but don't surprise the patient. You have to be clear from the start. Okay. Dr. Abdulatif, you can proceed.
Good afternoon. My name is Dr. Abdulatif Ali, ED Registrar. May I know your name and age, please?
Yeah, I am Nadia. I am 30 years.
Nice to meet you, Ms. Nadia. So Ms. Nadia, how can I help you today?
Yeah, I was in the party and my friend fought me and punched me in the right eye.
Oh, I'm sorry to hear that, Ms. Nadia. So do you have any pain? So I will give you a painkiller now.
No, no pain. I took painkiller.
Okay, Ms. Nadia, I'm going to wash my hand and wear PPE. And Ms. Nadia, would you mind if I attend with us?
Okay.
Okay, Ms. Nadia, I'm going to ask you some questions related to this problem, and also I'm going to do a examination. So my examination will involve I'm going to look and feel, move, and also I might do some special test, and I will use some gadget or some device to assess your eyes, your ears, and also your mouth and nose. Is that okay with you?
Yeah, okay.
Okay, Ms. Nadia, first I'm going to start my examination by inspection. So I'm going to inspect your forehead, your eyes, your teeth, and your nose, your mouth, your ears for any bruise, ecchymosis, or any wound. And then I will look around your eyes for any hematoma, for any swelling, and also for eyes inside the eyes for any bleeding, and also I will see your nose from inside for any septal hematoma. So now I'm going to look to your side, to the ear, and also I will look for any bruise, for any discharge from your ear or around your ear, and also I will look from behind the ear for any ecchymosis at the behind your ear at the area of the mastoid. I think you don't know it. And also I'm going to look, Nadia, to the back of your head, and also for the same thing for ecchymosis, for any deformity, and also I will look from the skull from upside. Okay, now Ms. Nadia, I'm going to do palpation, and I'm going to touch you. So I will do palpation for the forehead, for any step deformity, for any tenderness, and also I will assess around your eyes. So you said your trauma in your right or left eyes? Right. So I will start by left eyes, and then I will do around the right eye. Any tenderness?
This is discomfort, facial discomfort.
Okay, sorry. Sorry, Ms. Nadia, for that. Do you want me to offer you a painkiller?
It's okay.
Okay, so and then I'll proceed to assess your visual field. So I will start from, can you mirror me? I will start from outside to the center, and from outside upper to the center, lower to the center, from each side for 4 different area. So how about the visual field?
Okay, there's blurring of vision in the right side.
Okay, sorry for that. And now I'm using. Can you look to that chart and tell me which is the last row that you see?
Blurring of vision in the right side.
Okay, also this is for visual acuity. So now I'm gonna do check the extraocular muscle. So can you mirror me? I want you to close one eyes and to look to my finger in front of you, and keep your head still, and look to my finger. And if you feel any pain or double vision, tell me. Okay. So okay, I'm going from center to lateral and go up, down. Then I go back to the center, go up, down.
There is double vision in the right side when looking up in the right side.
Okay. Now I would like you to look to the wall behind me, and look to the finger in front of me immediately.
Okay, done.
Accommodation. And also I want to check your pubic. So I will flash this torch in your eyes. Okay.
Done.
Okay. I will look for consensual also, consensual pubic constriction. Then I will I'm gonna check for your nose, inside your nose for septal. I use a speculum to see if there is any septal hematoma. Then I'm going to ask you, please, can you open your mouth? And you can see inside your mouth or any laceration for any extracted teeth. And then, Ms. Nadia, can you just bite this tongue for me in left side of your mouth, then bite it in right side of your mouth to assess the mandible. Then I would like you to open your mouth, and I'm gonna grab the upper jaw, and I will put my other hand to support your face.
Thank you,
behind.
Dr. Abdul Latif. Thank you. Okay. Well done, Dr. Abdul Latif, but you are not controlling the time. Well done.
Can I try, Dr. Hani, this station?
Okay, let me to show people how to save time in examination, how to get 10 out of 10 in examination. Okay. Okay. So I will start the 6 minutes. Okay. Who want to be the actor? Who want to be the actor?
Okay, I can be the actor, Dr. Hani, no problem.
Okay. Start 6 minutes. Okay. Good morning. I'm Dr. Hani, one of the A&E doctor. I'm the most senior here. May I know your name and age, please?
Yes, I'm Nadia, 23 years old.
Nice to meet you, Nadia. I'm here to examine you. I have been informed that you have assault. Is that right?
Yes, I have been punched in my right side of the face.
I'm sorry to hear that. So are you comfortable now? Do you need painkiller?
Yes, I'm fine.
Okay. So I need to examine your face and the scalp. This involves me to look, feel, move, do some special tests to your eyes, nose, mouth, ear, and the scalp. Is that okay with you?
Okay, no problem.
Okay, no need to expose your body, just I will examine your face and the scalp. So first of all, I will be behind, in front of you to check your face for any, from the above to down, for any laceration, any wound, any injuries. And I will check for the eyes, above the eyes and below the eyes, for any ecchymosis, any swelling, any redness, any conjunctival hemorrhage. Also in the...
There is ecchymosis in the right side of the face.
Oh, okay. So after that, I will check for the nose, any laceration, any injuries, any inside the nose, any septal hematoma, and also above the upper lip and below the lower lip. Okay. Can you open your mouth for me, please? So I will check for any tooth loss or any laceration, any wounds inside the mouth, and also for any deformity. I will check from the sides. Sorry. Okay. For any laceration in one inside or outside the ear, any bleeding. Okay. In the other ear, the same also. And from behind for any wounds, any injuries, and the scalp from above for the same. Okay. Thank you. So now I will palpate. So I will feel from above to down for forehead, for any step deformity or any tenderness looking at the eyes of the patient. So for above and below the left eye, for any crepitus or any step deformity or discomfort in the face of the patient. In the right eye, I can see discomfort. Okay, so the patient, sorry, do you need painkiller now?
No, it's okay, fine.
So I will feel the nose for any step deformity or any laceration, any tenderness, also above and below the mouth. Also, I will feel the mouth from inside. Can you open your mouth? So I will check for step deformity, any moving tooth, and also I will hold the upper teeth and I will support the face by the other hand, move the upper teeth up and down and right to left to check for low forte fracture. Thank you. And also, can you bite this tongue depressor from the left side? Thank you. I can check the occlusion of the mouth and the teeth. At the other side, please. Yeah, thank you. I will check for from the sides. Okay, for sorry. Okay. I will feel the ear from behind and from in front, and for any laceration, step deformity, and the tenderness also looking at the eyes of the patient, and from the other side the same, and from the scalp from outside, from down to up for any step deformity, for any laceration. Thank you. Checking for tenderness also, looking at the eyes of the patient. And now I will do a special test for the eye. Can you please check this name chart, cover the normal eye? Okay, there is blurring of vision, sorry. Okay, so can you check, can you fix your head and look at my finger? Fix your head and follow my finger by your eyes only. Can you see that? Can you see that? Can you see that? Can you see that? Okay, so
I got double vision when I looked upward in the right eye.
Yeah, thank you. Okay, so I will do pupillary reflexes, direct and consensual in the other eye, and swinging, okay, and accommodation reflex. Okay, look at the wall, please, straight, and look at my eye and my finger close to your nose. So now I will check for convergence and constriction. Thank you. After that, I will do edge test. Fix your head and look at my finger. Edge test. So tell me if you have pain or double vision. So I will check for nystagmus. Okay. So
I
you
have
have
double vision in my right eye.
Yeah, thank you. Sorry. Okay, so now I will check for ear, for for device inside your ear. It's not painful. So I will check for any tympanic membrane perforation or any laceration. In the other ear, the same. And also from the mouth we did already. So I will check for sensation. Can you feel that? Please close your eyes.
Yes.
Can you feel that? Yes.
Yes.
Can you feel that?
Yes.
Yes. Can you feel that? So supraorbital intact. Can you feel that? Maxillary
Yes.
or infraorbital? Can you feel that? No.
No.
So infraorbital not intact in the right eye. Can you feel that? Yes. Can you feel that? So mandibular intact. So I need to do X-ray for the patient. X-ray showing teardrop fracture. So I need to refer the patient to ophthalmic for ophthalmologist. Okay, let me help you to redress. Are you comfortable now?
Yes, thank you very much.
Yeah. So this how to deal with the station. You can verbalize everything quickly and communicate with the patient and verbalize to the examiner in the meanwhile. Okay, guys?
Yes, sir.
Yeah, in examination, in the management plan, no need to talk about everything in the management plan. No need to say, I will do examination, complete examination, I will do blood test, I will do blah, 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 blah. The most important, I will do X-ray for your face, okay? Why? Because the patient has, already we mentioned in examination, the patient has here infraorbital nerve, it's not intact in the right side. This is an indication to do X-ray. It will be logic, okay? And the X-ray is showing the fracture. That's why the patient also has double vision or blurring of vision. So we are practicing within 6 minutes. In the exam, you will get more time to complete details. So if you still have time.
Sorry, Dr. Hani, to interrupt. Do I do the both sides, or should I just mention that I will repeat the same on the other ear? And I will repeat the same on the other eye, just to save time. What do you think?
Yeah, sometimes you have to do both sides. How you have to compare. Any comparison, you have to do both sides. So for example, here regarding visual acuity, no need, because no benefit. So just do on the affected one. So ask the patient to cover the normal one. Can you cover the normal one? Okay. Even you are not concentrating with the patient, which eye is normal, which eye is not affected. Okay. So ask the patient, can you cover the normal one? Okay. And check the lowest line. Thank you. After that, visual field. Can you cover the normal one? and they tell me if you see my finger. So you will do from 4 side. Clear, Dr. Husam?
Yes, Dr. Hani, clear.
But regarding sensation here very important. How you compare? Maybe the patient has a problem in this side also. So start by the normal one. Can you feel that? Can you feel that? Supraorbital intact. Can you feel that? Yes. Can you feel that? No. So infraorbital in the right side, not intact. Can you feel that? Can you feel that? Yes. So mental, or you can say mandibular division, it's intact, and so on. Okay. You have to do both sides in sensation. Okay. Next station, guys. We don't want to waste time. Who is happy to do the next station? Dr. Abdullah Malik.
Yes, Doctor. Assalamu alaikum.
Alaikum salam. Okay. Eye examination is very important, and the ear examination, because it will help you in other stations. Okay, you have 30 seconds.
Yes.
Neck swelling, what does it mean?
Thyroid.
Thyroid.
Yes, in any exam, check the equipment. If you don't understand the station, please, Dr. Abdullah, you have children beside you.
Yes, Doctor. Just 1 minute. Yes.
Yeah. So any exam in examination stations, so check the equipment. The equipment will be clear for you. So, for example, if you find paper, means for thyroid. Sip of water, it's thyroid. Okay. And the tendon hammer, so confirm it's thyroid. Okay. And the next one, for sure, you will examine thyroid. Okay. Okay. If you are ready, you can start, Dr. Abdullah.
Yes. Good evening. I'm Dr. Abdullah Malik, one of the registrar. May I know your name and age, please?
Yeah, Safi, 35 years.
Nice to meet you, Mr. Safi. I have been informed to take some data from you and examine you regarding your neck swelling. Would it be okay with you?
There is no data here, examination only.
Yes, I will be just taking some few questions, and I will be going to examine you regarding your.
Sorry,
neck
Dr.
swelling.
Abdullah, we can start again. Please, guys, here if they said do examination, so I have been asked to do examination for you. Okay, the examiner will think you don't understand the station. He will take bad impression about you. Okay. There is no history here, no history. Okay. Okay. If you want to ask the patient, it's not a big issue. At any time you will ask the patient or any question, it's not a big issue. Don't worry. But at least examination, it means take examination on. Okay, you can start, please.
Okay. Good evening. I'm Dr. Abdullah Malik, one of the registrar. May I know your name and age, please?
Yeah, Safi, 35 years.
Nice to meet you, Mr. Safi. I have been asked to examine you regarding your neck swelling. Would it be okay with you?
Yeah, please.
Okay. Do you have any pain? So I will offer you painkiller.
I took painkiller.
Okay. So are you comfortable?
Yeah.
Okay. I need to check vital signs. Mr. Safi, I will be going to examine your neck, and this involves me to look, feel, and do some special tests for you. And I would like to expose your neck and upper body. Please, is it possible for you?
Yeah, sure.
Okay. So I need to have my equipment. I need a stethoscope. I need a piece of paper, a tendon hammer, and a glass of water. Okay. First of all, I will be going to do general inspection from the front, and I will check for the face, and I will be looking for the signs of any sweating or any anxiety or anything, and any prescriptions besides the patient or any mobility aids. And then I will do general inspection for the eyes, I will check for any proptosis or any lid lag. Can you check? Can you please look down with my finger? I'm moving my finger down. I will check for the lid lag from the front. Okay. Now I will inspect from the side for any proptosis or any exophthalmos. Okay. So now I will also be looking in general inspection for your hands. Can you put your hands in front of me, and I will inspect the dorsum of the hands for any clubbing or thyroid acropathy or any tremors. Okay. So, or any chronicia. Okay. Can you put your hands other side? I will examine for any pulmonary edema or any sweating in the palms or hypothermia or thinner wasting. Okay. Now I will, can you stretch your hands again? I will put a piece of paper on above your hands to check for any tremors. Okay. So after that, I want to check your pulse. I will just check for a radial pulse if it is rate, rhythm, and volume. If it is high pulse for suggesting tachycardia, or if it is a low pulse suggesting for hypothyroidism. Okay. Now I will just also come quickly for the general inspection of the neck. First of all, I want you, I will see for any swelling or any masses in front of the neck or any swelling. Can you swallow a sip of water, please? I will examine for any swelling, any swelling moving with the sip of water. Okay, okay. So now, can you protrude your tongue? So I will inspect your tongue again from the front for check any swelling move with your tongue protrusion. Now I will be go behind you, and I will be going to palpate your neck from behind to check for the masses or any in the isthmus for the thyroid gland, and I will check for any asymmetry or any swelling in the neck from the side and in the center. And also I will palpate for the lymph nodes, anterior cervical, posterior cervical, preauricular and postauricular lymph nodes. And now I want to do for you auscultation for the thyroid gland with the stethoscope. I will auscultate also carotid bruit, and also I will, after auscultation of the gland, I want to do some reflexes for you. I will check for hyperreflexia if there is a, also I will need to check for trachea position. I will assess the trachea center, or it's not deviated due to any masses, or, and also I want to do percussion for the sternum for any extension of the mass, any dullness in the upper part of the mediastinum, and we'll check for the finger breadths between the trachea and between the cricoid and the sternum. Okay, and after that I want to do some special test for to check for its hyperthyroidism or low. I want to check for hyperreflexia by checking for the reflexes, for tendon reflexes. Okay, and first I will do the knee jerk, and please could you let your arms and could you let your legs floppy, and I will check for the knee jerk with the tendon hammer. If it is exaggerated, it could be suggesting for hyperthyroidism. And also the biceps reflexes. I will check the knees for vertebral myxedema. And after that, can you put your arms across your chest and stand up without any support? Also, just complete my examination. So any positive findings?
Okay, so the patient has symptoms of tremors and exaggerated reflexes.
Okay, so Mr. Safi, according to your examination, as you have high exaggerated reflexes and tremors, this most likely suggests that you have hyperactivity of your thyroid gland in the front of the neck. And for that, I will be doing some special tests for you, and which is including thyroid profile. And depending on the laboratory results, I will be arranging an appointment with endocrinologist for you to start medicine for your suggestive hyperthyroidism. Would my management plan be okay with you?
Thank you, Dr. Abdullah. Okay,
Yes,
well done.
thank you.
Well done. Amazing. Okay. Here you are practicing within 6 minutes, and it's good. You did the exam. You started by the face, right?
Yes, yes.
No worries if you start by the face or start by the hand. But which one is better? If you will do this one again, which one is better?
Hands better, I think.
Yes, because the
Then
examiner
calm
will
marks
think
better.
you are not organized, right? Or you don't know the
Yes,
station.
exactly.
Okay, so all people will start by the hand except you. It's not good, right?
Yes, yes.
Okay, so first of all, why you will do examination for the patient?
To check and to diagnose that it's hyperthyroidism or hypothyroidism.
Did you explain to the patient from the start? Did you explain to the examiner what you are doing?
Yes, I did not explain, but I just took consent like in a short way that I will be
Yes, you took consent
examining you to.
for the
Yes,
examination only, right?
yes, exactly. But should explain that why
Yes,
I'm going to do that.
yes.
Okay.
I have been informed that you
Because I
have.
thought again I will be sorry.
I have been informed that you have neck swelling. Is that right? Yeah, I'm sorry to hear that.
Hello. Yes. Okay.
I have been informed that you have neck swelling. Is that right? Yeah, I'm sorry to hear that.
Yes. Mhm.
After that, you can explain to the patient, I need to examine your neck. I need to examine your neck. This involves to look, feel, and move, and do some special tests to check if you have thyroid gland problem or other problem. Okay. So the examiner here will understand that you are professional from the start. Okay. So you will start by the hand. You have many stations. You will start by the hand. Like what? Thyroid.
Thyroid. And also
Cardiovascular.
Cardiovascular, respiratory,
Respiratory.
abdominal examination,
Abdomen.
peripheral vascular.
Peripheral vascular, you can start by lower or upper, no problem. Okay. So this station, you have to start by that. So always start by the palm. Okay. So the palm here, what do you need from the palm? Palmar erythema or
Waist of the muscle.
okay. So here you have to check for the palm for any wasting, any sweating, any dryness. So for hyper and hypothyroidism. Okay. Please, guys, make mute to your mic. It's noisy for other people, please. Okay. So after that, you will check for the dorsum. Can you do your hand like that? So if you ask the patient, can you do like that? It will save time. So after that, you can check for
Thyroid acropathy.
yes. After that, you can put the paper for fine tremors. Thank you. Always after each test, thank you. Don't forget that. It means you are thanking the patient and it means the test is done, finished. After that, you go for the already the radial pulse in the palm. Okay, you can check the radial pulse for rate, volume, character. Please, guys, make mute to the mic. So the rate, volume, character for 1 minute. Don't wait for 1 minute, just verbalize for 1 minute. After that, you can compare with the other hand. So here for fine tremors, for hyperthyroidism. Okay, thank you. After that, you will inspect the face. So you will check for outer third of eyebrow. So don't go for the eye first. First eyebrow. Okay. First the skin, the sweating and the dryness. So the face first. After that the eyebrow. After that the eye. Okay. So inspect for sweating, for dryness, for hyperthyroidism and hypothyroidism, and the loss of outer third of eyebrow or hypothyroidism. After that, you can check for the eye itself. So you will check for any exophthalmos, okay? And also for, you will check for both sides and from above. And inform the patient, I will check your eye from above. Don't surprise the patient, okay? So here, you will check for eye lid lag. So lid lag here, it means you will find the sclera only if the patient is looking down. But this one, it's not lid lag because you can see the sclera above and below and the sides when the patient is looking at you. This is not lid lag, okay? This is called exophthalmos, okay? If you don't find this one, you can ask the patient to look down. So if the patient has this one, no need to ask him for lid lag, okay? But for the purpose of the exam, you can do, no worries. So can you look down for lid lag, okay? After that, you will do for thyroid swelling. You have 3 tests. Only without drinking, without protruding the tongue, it will be inspection. So inspection without doing anything. After that, inspection with drinking water. After that, inspection with protruding the tongue. Okay. So I will check the neck from in front for any swelling for thyroid mass. Can you drink a sip of water for me? And look, can you protrude your tongue? Thank you. After that, I will do the same. I will feel your neck from behind. You have to warn him before doing that. Don't surprise him. I need to feel your neck from behind. I will check for thyroid mass without doing anything. After that, with drinking water. After that, with protruding the tongue. Thank you. After that, you will do lymph nodes. You will check for lymph nodes. And here, lymph node, you can verbalize them quickly. Otherwise, just verbalize, I will feel your lymph nodes. Okay. In feeling here, when you feel the thyroid, just verbalize to the examiner because the examiner cannot see you. So now I can feel the thyroid cartilage. I can go down the isthmus, the right loop. After that, I can feel the left loop. Okay. Okay. So after that, you ask the patient to drink a sip of water. After that, you ask the patient to protrude his tongue. And then lymph nodes. After that, I will listen to your thyroid gland for Berwi. After that, I will check your trachea for any deviation, for any mass, thyroid gland mass. I will tap on your chest for any mass. After that, I will do reflexes. Do reflexes here, you can do on the knee only. No need to do for all reflexes. Okay, you can tell the examiner, ideally, I do reflexes for all limbs. Okay. After that, you can do the pretibial as Dr. Abdullah did. Okay, well done, Dr. Abdullah. Just small points you have to cover.
Yes, thank you.
Okay, next one, guys. Who is happy to do the next one?
I can do the plan.
Okay. You have 30 seconds to prepare yourself. You can start.
Hello, I'm Dr. Ahmed Lamin, ED Registrar. May I confirm your name and age, please?
Yeah, I am Khan. I am 23 years.
Nice to meet you, Mr. Khan. Today I've been informed that you're having a problem with your face. Is this correct?
Yeah, I woke up today 1 hour ago and I felt something wrong in my right side in the face.
Oh, I'm so sorry for that. Are you having any pain right now? Would you like me to
No.
offer you pain medications?
No, it's okay.
Okay. So, Mr. Khan, I have been informed to examine your face. Okay, this will involve me examining the nerves that supply your face, your head, and your neck. Okay, I will have to look, feel, move, and also do some special tests for you. Would that be okay with you?
Yeah.
Okay, do you mind if a nurse will be attending with us?
Okay.
Okay, so let me first check your vital signs. Okay, so Mr. Khan, I'm going to start by general inspection. I'm going to look for any prescription with the patient, any mobility aids, any visual aids, any auditory aids. Okay, Mr. Khan, I would like to ask you, have you noticed recently that you have any change in your smell? Okay,
No.
Thank you. The olfactory nerve check. Okay, Mr. Khan, I would like now to check for your eyes and your vision. Okay, so I would like you to look at this Snell's chart. Okay, cover your right eye and tell me, can you read the last line? Okay, excellent. Can you repeat that with the other side? Okay, excellent. Now, Mr. Khan, I would like to check for the field of your vision. Okay, can you please close one of your eyes, look at me, and I'm going to mirror you. Okay, Mr. Khan, you can see my face. Okay, so central vision check. Okay, can you please tell me when you can see my finger? I'm going to go from the periphery to the center on the 4 direction. Okay, thank you very much, Mr. Khan. I'm going to repeat this with the other eye, please. Okay, thank you very much. Now, Mr. Khan, I would like to check the reaction of your eyes to the light. I need to dim the light of the room. Okay, I need the torch. Okay, I'm going to check the right eye for the pupillary reaction. I'm going to check for the consensual on the other side, and then the swinging test. Thank you very much, Mr. Khan. I'm going to repeat this on the other side. Okay, now, Mr. Khan, I would like to check for the ability of your eyes to accommodate near vision. Can you look behind me on the wall? Thank you very much. Now, can you look at my finger? Thank you very much. Okay, Mr. Khan, now I would like to check the back of the eye using the ophthalmoscope. Okay, on the right side and on the left side. Should I proceed with the ophthalmoscope?
Done.
Okay, thank you very much, Mr. Khan. Now I have checked the optic nerve for the patient, check. Okay, now, Mr. Khan, I would like to check the nerves which supply the movement to your eyes, named the oculomotor abducent and trochlear nerve. So I need you to look directly into my face and do not move your head. I need you just to follow my finger. Okay, I'm going to do the edge test, right up, down, left up, down. Have you felt any pain or any double vision?
No.
Okay. So also I haven't found any nystagmus or any limitation of the movement of the eye. Now, Mr. Khan, I would like to check for the nerve that gives the sensation for your face, called the trigeminal nerve, and also give the movement for your jaw. Now, I'm going to hold your head from the side. Can you clench your teeth? Thank you very much. I'm going to hold it from the sides of the jaw. Clench your teeth. Thank you very much. Can you open your mouth? Can you move it from side to side? Thank you very much. Now I'm going to tap with this hammer on your chin to check for the reflex. Thank you very much. Now I need to check for the sensation. Can you feel this in your breastbone? Okay, with the cotton tip, I'm going to feel it. Right, left, left. Can you feel? Right side, left side. Okay, did this feel the same on both sides? Thank you very much. Now I'm going to check for the corneal reflex. Can you look upward? I'm going to try to touch your eye with this. Thank you very much. Now, Mr. Khan, I would like to check for the nerve that gives the movement for the muscles of your face, called the facial nerve. Okay, now I need you to raise your eyebrows up. Thank you very much. Can you close your eyes tightly? Do not let me open them. Thank you very much. Can you show me your teeth? Thank you very much. Can you blow your cheek and do not let me push them in? Thank you very much. Is there any abnormality? Okay, have you noticed any change in your taste sensation or that the sound are heard louder recently? Okay, thank you very much. Now I would like to check for the nerves which gives for the hearing and for the balance. Now I would like you to close your left ear, and I would like to repeat the word I'm going to say, the number I'm going to say, 66. Thank you. I should repeat that on the other side. Now I will do some tests with the tuning fork. First is the Weber test. Okay, can you feel it? Can you hear it on the right, left, or in the middle? Now I'm going to go for the Rene test. Can you hear that? Now can you hear that? Thank you very much. I need you to stand up, close your eyes, and I need you to march in spot. Okay, thank you very much. Vestibulocochlear nerve is checked. Now I need to check the vagus and the glossopharyngeal, the nerves of your throat. Can you open your mouth, please? Okay, I'm going to check for the uvula position. Okay, I need you to cough. Thank you very much. Now take this water, sip of water. Can you swallow it when ready? Okay, thank you very much. I'm going to check for the gag reflex. Okay, thank you very much. Now I need to check for the nerve which supply your tongue, which is called the hypoglossal nerve. Now I need you to open your mouth. I'm going to look for any wasting of the tongue or any fasciculation. Can you protrude your tongue out? Thank you very much. Now inside, can you push your tongue against the cheek? Do not let me push on the one side, and I repeat on the other side. Thank you very much. Hypoglossal nerve is checked. Now I need you to turn your head against my hand. Okay, thank you. Turn against the other side. Thank you. I need you to raise your shoulder up. Thank you very much. Against my hand. Okay, its final accessory nerve has been checked. Is there any abnormality found with Mr. Sir, I have completed my examination, Mr. Khan. Is there any abnormalities found? Hello?
Okay, thank you, Dr. Ahmed.
Okay, thank you, Dr.
Okay, well done. Here you finished almost on 6 minutes. I know it's a very, very long station. The cranial nerve is the longest station. Okay, but you did very well. Amazing. You verbalized everything. I can understand that what you are doing. Guys, all of you, you are examiners. Did you feel that Dr. Ahmed is doing each nerve?
Yes.
Yes, yes, very nice.
Yes.
Yeah. Amazing, Dr. Ahmed. So here the examiner sometimes cannot see you. So verbalize like Dr. Ahmed did, okay? He will understand what you are doing, which nerve you are examining, and what you are asking the patient. And the communication, he's communicating with the actor very nicely, okay? And very simply, and easily. And he's controlling his tone, controlling his time, okay? I know he did not reach the management, okay? But I will ask him, like the examiner, what is your finding, Dr. Ahmed?
Dr. Hani, sorry, just I have a patient.
Okay,
sorry.
what is the finding, guys?
There is no finding. He didn't answer.
There is no findings.
If there is no finding, what does it mean?
Central
problem.
Central facial nerve, upper motor neuron lesion, right? Okay. If you ask the patient, can you raise your eyebrow? If he can raise both, can you close your both eyes? Okay. So if the patient can close both eyes, what does it mean? Upper or lower?
Upper.
Upper. Okay.
Upper.
Close 2 eyes, upper. Close 1 eye, lower. Clear? Okay. And in the exam, some people they diagnosed as trigeminal. Why trigeminal? The patient has normal sensation. Okay. Can you feel that? So in trigeminal, here, can you feel that on your sternum? Yes. Please close both eyes and tell me if you feel. Say yes. So can you feel that? Yes. 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 So trigeminal intact. Okay.
No, doctor, that is separate. That is different. That is another patient. He came with the pain when he's chewing and he's opening mouth, and he feel the pain that here, and otherwise no pain. And this is burning sensation. That was different case.
Okay. So you mean different station. Okay.
Yeah,
so
that was different.
Yes.
This was
in
different.
a way, if the patient you ask him clearly, do you have any change in smell? If he said yes, what is the problem?
Olfactory nerve.
Olfactory nerve. Okay. If the patient has any change in smell, so the problem here in olfactory. Okay. If the patient has problem in visual acuity or visual field, what is the problem?
Optic nerve.
Optic. If the patient has problem in H test and he has double vision or pain when following H test, what is the problem?
Third, fourth, and sixth.
Third, fourth, or sixth. Third,
Mm.
fourth, or sixth. Okay. Okay. After that, if he has problem in sensation, what is the problem?
Trigeminal nerve.
Trigeminal. Okay. If the patient has problem in reflexes, like jaw reflex, okay, so it means trigeminal nerve. If the patient has a problem in closing eyes, it means facial. How you
Yes.
understand facial? If the patient has closing both eyes, it's a central. Closing only one eye, it's a peripheral. Means
Normal.
upper and lower motor neuron lesion. Okay, and so on. So step by step, and everything will be clear for you. Well done, Dr. Ahmed. So he did visual acuity. After that, visual field. After that, H test for oculomotor motility. After that, reflexes, direct and consensual in the other eye, and rapid and accommodation. Here, regarding you are checking the muscles of the temporalis and the masseter and the medial trigoid. So 3 muscles. So you will put your hands on these muscles here, one hand here and one hand in the other side, and ask him to clench his mouth and open his mouth. Okay, so you will feel the strength of these muscles. It means you are checking trigeminal, and after that you will put one finger. Tell him I will use this hammer. It's not painful, so you will check for jaw reflex. After that, sensation. Can you feel that? Can you feel that? Can you feel that? But compare left with right, left with right, left with right. Don't do all left after that all right. No. One upper with the other upper. One middle with the other middle. One lower with the other lower, and so on. Okay. So after that, number 7, facial. So you can ask him, before asking him, you can verbalize to the examiner any change in hearing, any change in taste. 2 questions: any change in hearing, any change in taste. After that, I will check for asymmetry. After that, you can go from up to down or from down to up. It's up to you. I prefer to go from up to down. So can you raise your eyebrow from up? After that, can you close your eyes? After that, can you smile? Can you bare your teeth? Can you whistle? Okay. So after that, number 8, whisper test. We did already in ear examination and Weber test. Don't waste the time in Weber and Rene. Okay. Just verbalize quickly. I will do Weber on the forehead for both ears, and I will do Rene test behind the ear and in front of the ear for both ears. Done. Don't waste the time. Okay. And you can ask the examiner any finding, any abnormality. Ask the examiner clearly to save time. After that, you will check for which nerve here, guys?
Ninth.
Glossopharyngeal.
Vagus and hypoglossal. Vagus and
Hypoglossal.
glossopharyngeal. No.
Okay.
This is hypoglossal.
Yes. So deviation or fasciculation for hypoglossal, and this one. So you are checking both together. You can verbalize to the examiner. Already you finished number 7 and number 8. Now you are in number 9 and 10 and 12. 9, 10, 12. Okay. So can you open your mouth? I will check inspection for any uvula deviation and any tongue fasciculation. Okay. Can you drink a sip of water? I will check for any cough or any gag reflex. Done.
Okay.
Can you protrude your tongue? I will check for any tongue deviation or any fasciculation. Okay. After that, number 11. So ask the patient, don't let me to push your face to the other side. Don't let me to push your shoulder down. So it's 11 intact. Done. Okay. So if the patient has all normal except facial and the central, what is the management?
CT.
CT neuro consultation.
So if he asks you what is the finding, if you find the problem in facial, you can tell the examiner the finding is facial nerve upper motor neuron lesion or facial nerve lower motor neuron lesion. It depends on closing the eyes. Sometimes the actor cannot act well, but he will do very well regarding closing the eyes. They can ask him to close one eye or close both eyes. Okay, will be very clear. But you have to exclude trigeminal. How to exclude trigeminal? Can you feel that? Can you feel that? In the face, up, lower, and the middle. Okay, next station. Who is happy to do that?
I will do.
Okay, we can go by turn, Dr. Raji and then Dr. Tariq.
Yeah, it's okay.
Yes,
My
sir.
turn is good.
Okay. This station, it's unlikely to come in the exam, but again, we don't know, maybe it will come. Even it's 1% to come, you have to study. If you are ready, you can start, Dr. Raji.
It's my turn. Okay, sir. I think he's going to do. Sorry.
Okay.
Sorry. Okay. Hello. Can I start, sir?
Yeah.
Yes, sir. Hello, I'm Dr. Rajalakshmi, ED Registrar. Can I confirm your name and age, please?
Yeah, James, 40 years.
Nice to meet you, Mr. James. I have been informed that you have some difficulty in breathing. Is it right?
Yeah.
Okay. Can you tell me more about your symptom?
Yeah, today increased and I couldn't tolerate.
Okay, I'm sorry about that. Are you comfortable now?
Yeah, it's okay.
I have been asked to examine your chest, which is including look, listen, and feel, and do some listen and tap on your chest. Would that be okay with you?
Okay.
For that, I need you to expose your upper body, and your privacy will be preserved. Is it okay?
Okay.
Okay, I'm going to start the examination. Can you outstretch your hand like this for me?
Okay.
I'm looking for any tar staining, any nail changes, can you turn them around, please? I'm looking for any wasting of the muscles. And can you do like this for me? I'm looking for clubbing, 2 fingers together. Okay.
Okay.
Now I'm going to feel your pulse in your wrist. I'm looking, feel for rate rhythm. Thank you. Can you look straight for me? I'm going to examine your eyes. I'm looking for any pallor. Thank you. Can you open your mouth? I'm looking for any central cyanosis, any mouth ulcers. Okay. Can you sit 45-degree for me, semi-reclined position? Can you turn your head towards the left side? I'm assessing the jugular venous pulse, any elevated jugular venous pulse. Thank you. Do you have any pain in your tummy?
No.
So okay, thank you. Now I'm going to press on your tummy. I'm looking for any elevated jugular pulse. Thank you. Now I'm going to look in a close look at your chest. I'm starting from, okay. I'm looking for any scars, any deformity, any chest wall deformity, any mass. Can you lift your right arm for me? I'm looking for any scars. Left arm for me. Thank you. Now I'm going to feel your neck. Feel the trachea, sit central or deviated. Thank you. Now I'm going to feel your chest. This is going to be, I'm going to place my hands around your chest. Is it okay?
Okay.
Can you take a deep breath in and out for me? Thank you. And also I need to do a check your pulse of your heart. First, second, third, mid-clavicular line, fifth, intercostal space, left side. Thank you. Now I'm going to tap on your chest. Is it okay? I'm tap on the supraclavicular area, infraclavicular area, upper chest, lower chest, and axilla on the both sides. Okay, thank you. Now I'm going to auscultate your chest with a stethoscope. Supraclavicular area with the bell, both sides, and upper chest, lower chest on the both sides, and axilla. Thank you. Can you please bend a little forward for me? I'm going to feel your glands in your neck. I'm palpate for submental, submandibular, preauricular, postauricular, and supraclavicular lymph nodes. Thank you. I'm going to do the same on the back side. For that, I'm going to keep my hands behind your back. Can you take a deep breath in and out for me? Thank you. Now I'm going to tap on your chest, both sides on the post. Okay, thank you. Now I'm going to auscultate your chest with a stethoscope, both sides. Okay. Can you can you tell me 99 for me when I place the stethoscope again? Thank you. I want to do the same on the front also. Thank you. And now I'm going to press on your lower back. Okay. I'm looking for any sacral edema. Thank you. Please, can you lie? And I'm going to check on your legs for pedal edema. And I'll squeeze the cough for any tenderness for deep DVT. Thank you, Mr. James. I have been completed my examination. Let me help you to redress. Are you comfortable now?
Yeah, I'm the examiner. What is the diagnosis, doctor?
I don't find any.
Okay, so if all normal, what is the diagnosis?
It's from the inspection and palpation and percussion, there is no significant abnormality. So the examination is normal. Normal respiratory.
Okay.
Thank you.
Okay. Here, what is the expected diagnosis?
P. P.
Okay, so if you have finding, did you ask me about finding?
No, I didn't ask. Yes.
You did not ask. Okay, so here regarding, we will start from the beginning.
Okay.
Regarding, okay, so here regarding the deviation, did you ask the examiner any deviation?
No.
You have to ask any deviation. Okay. If he answer, okay. If he did not, okay. Okay. After that, in resuscitation, with expansion, any abnormality? What about expansion?
Okay.
If he answer you, okay. If he did not, you can proceed. Okay. What about percussion? Any abnormality? You are doing that in resuscitation, right?
Yes, sir. Yes.
Yeah, it's very easy. This station, even you are not studying the same as resuscitation. Okay. But here only in resuscitation, you are doing airway, breathing, circulation, disability, exposure, right?
Yes.
Here you are doing breathing only, right?
Yes, sir.
Yeah, very easy. Okay. And very short because you will do breathing only. So in percussion, but don't ask the examiner about the finding until you finish all percussion. So I will do percussion above the clavicle, both sides. I will do below the clavicle, both sides. Above the navel, both sides. Below the navel, both sides. Any abnormality? This is how to verbalize. Clear?
Okay, sir.
Yeah. Okay. And after that, auscultation. Okay. So above the clavicle, by pelvic stethoscope, both sides. I will do auscultation above the navel, both sides, by diaphragm of stethoscope. Below the navel, both sides. And in the axilla, both sides. Any abnormality? What about air entry, both sides? Okay. If he answer you, okay. If he did not answer you, proceed. Okay.
Okay.
This is how to catch the station. Okay. So after that, we finish already inspection. In inspection, you did not verbalize. So in inspection from the start here, inspection, I will be looking at the chest closely. So for any scars, pacemaker scar, midline sternotomy scar, mid-axillary scar, anterolateral thoracotomy scar. Okay, this is how to verbalize in the exam. Okay, and after that, can you raise your arm? So you will check for lateral thoracotomy. Okay, after that, you can ask the examiner any finding. Okay, but don't wait for results. Okay, after that, the trachea, I will check the trachea for deviation. Any finding? After that, assess cricosternal distance. After that, feel or palpate the apex of the heart. So you can say clavicle, 1, 2, 3, 4, fifths inter mid-axillary, mid-clavicular line. Okay. After that, expansion. So can you take deep breath for me? And out. Thank you. Any abnormality? After that, percussion. After that, auscultation. Any finding? After that, can you sit for me? I will feel lymph nodes in your neck. I will be behind you. Okay. So you can just verbalize the names quickly. Submental, preauricular, submandibular, preauricular, posteroauricular. After that, anterocervical, posterior-cervical, supraclavicular. Done. Don't waste the time. After that, percussion. So we started on the anterior chest. So you can do the same on the posterior chest. Okay. So it will be percussion, auscultation only on the back. So an expansion also. So you will do expansion, after that percussion, after that auscultation. Here, no need to waste the time, because if the patient has problem in auscultation anterior, maybe he has the same problem. But if it's normal in the anterior, most likely will be normal in the posterior. So don't waste the time. After that, check, feel for lower back, for sacral edema. Can you expose your leg? I will check for pedal edema. Okay, for right ventricular failure. And also I will check for tenderness, looking at the eyes of the patient. I will hold the cuff for signs of DVT. You have to verbalize like that. Okay, so if the examiner did not mention any abnormality, it means a normal finding, right?
Yes, sir.
So you can verbalize the patient has difficulty breathing and the normal finding, I have to rule out pulmonary embolism. Okay.
Okay.
Any patient with normal finding, it's indicating pulmonary embolism because it's score 3, no other diagnosis, right?
Yes, sir.
Okay. And here you have to do X-ray for the chest, and you have to do continue or complete Wells score. So you have to verbalize to the examiner like that. I need to do X-ray no other diagnosis clear, and I need to do X-ray and complete a scoring system for Wells score. Clear?
Yes, sir.
Yeah. Okay. If high risk, what you will do for DVT or for
Just
pulmonary embolism?
pulmonary angio.
So you have to do the CTPA and give the patient blood thinning medication. Okay, well done, Dr. Raji. Welcome. Dr. Tariq?
Yes, sir.
Okay. Are you happy to do the next session?
Inshallah.
Okay. You can start.
Okay, I will wash my hand and wear PP. Hello, Mr. I'm Dr. Tariq, one of the senior doctor in emergency department today. I have been asked that I have to examine your heart especially. Is it okay with you?
Okay.
Can you let me know that what is the problem? What do you feel today?
Yeah, I have heart racing, doctor.
I'm sorry. I will keep you under observation in the resuscitation room and I will do your ECG and check the vital signs. Are you feel okay, comfortable at this time?
It's okay.
So it involves that I have to inspect and I have to feel and palpate, and I will do some special test with my stethoscope and I will examine you. It's okay with you?
Okay.
First of all, I will keep, for this reason, I will expose your upper portion, upper part of the body, and I will ask my sister as a chaperone also. It's okay with you? So I will start from the inspection. I will start from the hands. I will look on the hands that any splinter hemorrhage, any koilonectia on the dorsum, any swelling or any redness, and then I will go on the supination and I will check the hand that there is wasting of the muscle, palmar erythema, or any wasting of the muscles, any redness. And then I will go further up and I will see on the lower arms any redness and swelling. Then I will go for the chest and I will see on the chest any deformity that on the heart side and any bruises. I will see any visible vessels on the chest and any palpation, and I will check also as well as neck, that any distension of the neck veins as well. Now I will start from the hand and I will check the pulse. Now I will feel, first of all, I will feel any bilateral temperature of the hands. Then I will go for the radial pulse and I will check for the ulnar pulse. And after that, I will go with the brachial pulse. Then I will go on the left side. I will check one by one, first on the right, then I will go for the left side. And I will check all the radial pulse and I will check any radial delay is there or not. And I will check after that the pulse rate and corrector of the pulse. Is it normal? It is regular or irregular? And this high volume pulse or low volume pulse. Then I will check the water hammer pulse. I will put my hand on the lower arm and I will pull at 90 degree and I will see that I will feel any pulse. After that, I will go on the chest. I will see, first of all, I will palpate on the chest. I will go for on the heart side. I will see that there is a visible pulsation and I feel any palpation on the chest. Then I will auscultate and I will auscultate. I will go with my stethoscope. First of all, I will see that any carotid bruit and I will check the pulse, carotid pulse, and I will check that the pulsation is carotid pulse is normal or not. And I will press first of all on the abdomen and I will see that pressure is increasing or decreasing. Then I will go on the heart side. I will palpate first of all the four part on the right, second intercostal, left second intercostal. Then I will go the fourth and fifth intercostal. And I will check any midline shift of the mitral area, that's the base of the fifth intercostal base. I will see that apex beat is shifted or not. Then I will check on the right ventricular heave. I will check the left ventricular heave. And after that, I will palpate on the any pulsation that is visible on the aortic area, right side of the intercostal space, second intercostal space. Then I will take the stethoscope and I will auscultate with my stethoscope to see the heart sounds. First, I will go from the mitral area. I will put in the mitral area on the fifth intercostal space, base of the fifth intercostal space, that sounds are normal or any abnormal sound is hearing or not. And then here I will see with bell of my stethoscope. Then I will go on the lateral side that if it is normal or not. If it is displaced, maybe there is a heart problem, and if there is a abnormal sounds, maybe valvular problem is there. Then I will go on the fourth intercostal space, and then I will go for the right second intercostal space to see the aortic sounds. If there is any abnormal aortic sounds, it means there is if abnormal aortic sound is going to upward the neck, maybe there is some stenosis of the valve. And then I will go on the left second intercostal space to see the mitral valve. And I will see in the mitral valve. Then I will percussion. I will do on percussion on the heart areas to feel any dullness or any abnormality on percussion on the left side of the heart. And after that, I will go and I will see that any lymph nodes on the neck or any bruises on the neck is present or not. I think so. And then after that, I will go for see the radio femoral delay as well as, and I will check. I will ask my sister that you have to check the blood pressure from upper and lower arm.
Thank you, Dr. Khan. Okay, thank you. Okay, what is the finding?
Finding didn't tell me anything. I'm going, but I couldn't find anything.
Okay, so you said your sister. What is your sister? What do you mean by sister?
Yani staff, senior staff.
Okay.
Check the.
Okay, they don't know sister there. Okay.
Okay.
Yeah,
Staff.
you have to. Yeah, you can say one nurse to attend with us. More than enough. Don't say sister. Okay.
Okay.
Okay. Well done. You are doing well, but you are not focused.
Systematic.
You are not focused. Okay. And here from the start, you have to start by the hand. Okay. Regarding Dr. Raji, you check the radial pulse in breathing. No need for radial pulse in breathing. Okay. So they are testing your skills in breathing. So focus on the breathing. They are testing your skills in cardiovascular. Focus on heart only. Okay.
Okay, sir.
If you will mix, they will think you are not understanding the station. Okay. So in this station, heart, it means heart and the vessels. Okay. So I will start from the beginning. Okay. So first of all, after consent, you have to ask the patient, can you do your hand like that? I will check for blah, blah, blah. Anything related to the heart. So what is related to the heart here? Valor.
There is a, yes.
Valor. Very easy, guys. Here, the heart, we are talking about arteries and the veins coming and going from the heart. So any valor, any cyanosis, any
splinter hemorrhage, clubbing.
Yes, anything for infective endocarditis. So splinter hemorrhage, ossular nodes, and. Okay, can you do your hand like that? I will check for blah, blah. Okay, so you can verbalize also. I will feel radial pulse for rate, rhythm, and character. Idle for 1 minute. Thank you. I will check for the other hand, for the other pulse, for radial delay. For what? For aortic carcotation. You have to verbalize like that to the examiner.
Okay.
Okay. I will Do you have any pain in your shoulder? No. So I will raise the hand. I will check for brachial pulse. I will assess for collapsing pulse. For what? For aortic regurgitation. This is how to verbalize to the examiner. This is how to get 10 out of 10. Okay. Thank you. I will auscultate or I will listen to carotid pulse in your neck by bell of stethoscope. Thank you. For carotid berwi. Thank you. After that, I will feel the pulse. So auscultation before feeling. Okay. So here also you have problem in phrasing sentences, Dr. Tariq, as I said before. So
yes, I'm trying for a long time,
yeah,
but
I need to do examination for your heart. If you will stop, it's not logic, because if you will say examination for your heart, why you will touch his neck? It means something wrong with you. So you have to inform him. This involve me to look, feel, and listen to your heart and your neck and your hand. Okay? You have to be clear with him. Don't surprise the patient. You did not inform him that you will touch his neck, right? So you have to inform him from the start. Okay? So here you have to listen for carotid berwi first. Maybe the patient has carotid berwi or carotid stenosis. If you will feel without auscultation, you will cause a stroke for him. So you have to do that first. After that, you will feel for carotid pulse one by one. Don't do both together. So you have to verbalize to the examiner, I will feel carotid pulse one by one. Okay? So for character, volume, ideally for 1 minute. After that, can you do your eyes like that? I will check for conjunctival pallor. Okay? I will check for exanthelasma. I will check for corneal arcus. They will not ask you what is exanthelasma. They will not ask you what is corneal arcus. Okay? Just verbalize quickly. Okay? Can you turn your head to the left side? I will check for jugular venous pressure. Do you have tummy pain? No. I will press on your tummy. I will check for elevated jugular venous pressure. Okay? I will do close inspection, or I will do looking at your chest closely. Okay? So you will check for scars. Mention the scars very quickly. Can you raise your arm? I will check for lateral thoracotomy. I will check for pacemaker scar, midline sternotomy scar, left mid-axillary scar, anterolateral thoracotomy scar. After that, tracheal deviation. After that, you will verbalize regarding the valves. You have 4 valves: mitral, pulmonary, aortic, and tricuspid. Fifth, fourth, second, left and right parasternal. Okay. So I will feel, or I will palpate apex beat. It will be 5th intercostal space. So clavicle, 1, 2, 3, 4, 5th clavicular line for apex beat. Thank you. I will assess for parasternal heave. So just put your hand, no need to verbalize anything. I will assess for parasternal heave for right ventricular hypertrophy. Okay, so we finished the inspection. After inspection, what, Dr. Tariq?
Auscultation.
Palpation.
Palpation, sorry.
Palpation. Okay, why you jump to auscultation? Okay, inspection. Here, no need for percussion because it's not chest. Okay, okay. So you finish inspection for scars. More than enough if you will mention a scar. Palpation, you will palpate the apex. After that, heave. After that, thrill. 3 points.
Thrill. Yes.
Assess for thrills across all 4 valves. Done. For what? Palpable murmurs. If the examiner, you have to ask the examiner clearly here. Any murmurs? Okay. Any palpable murmurs? If he said yes, where? Okay. According to the murmur, you will do auscultation on this murmur. Okay. Okay. So assess for thrills across all 4 valves: mitral, tricuspid, pulmonary, and aorta. So ask him clearly here, any palpable murmurs? If he did not comment, so just do normal examination. Okay. So you will do for fifths and the tricuspid, fourth, and the pulmonary and aorta by diaphragm of stethoscope. Okay. Here you will palpate the carotid pulse with auscultation for first heart sound and second heart sound. Okay. So you will do for mitral, fifth intercostal space in the mid-clavicular line. Here, pulmonary valve, second intercostal space, left sternal. After that, aortic, it will be second intercostal space, right. So here pulmonary, here aortic, left and right. Okay. Mitral, tricuspid. So while you are testing for first heart sound, you have to feel carotid pulse. Okay. After that, you will repeat the same with a Bell's stethoscope. You will do mitral, tricuspid, pulmonary, aortic. Clear, Dr. Tariq?
Yes.
Yeah. So,
Understand.
yeah. If there is no murmur, no need to do further assessment, no need to do further auscultation because no murmurs. Why you will do radiation of aortic or radiation of mitral? Okay. But if he mentioned, yes, murmur in the aortic, so you have to check for aortic radiation. So radiation of ejection systolic murmur often heard in aortic. Yeah. So if he said yes, there is murmur in the aortic area. Aortic area will be where? Right.
Right second intercostal space.
Right second intercostal space. So if you have palpable thrill here, and you heard by diaphragm and by pelvic stethoscope, so you will feel by hand thrill, and you will listen by diaphragm. Okay. For example, I will go again from the start. Okay. Here. So you will ask the patient, the examiner, I will assess thrills across 4 valves. Any palpable murmurs? He will say, for example, palpable murmur on the aortic area only. So what you will do? You will do auscultation for all. After that, you will do auscultation in aortic by 2 times. First time by diaphragm of stethoscope, second time by bell of stethoscope. So you will hear murmur. How to confirm it's aortic stenosis or aortic regurg? Okay, so you will do for aortic or carotid. Okay, if you found radiation,
yes,
ejection systolic murmur will be often heard on aortic stenosis. So you can ask the examiner. I will repeat listening in the carotid pulse for any radiation. Any radiation, if he said yes, so it's what?
Aortic stenosis.
If no radiation, it's not aortic stenosis. Okay.
Yes.
Okay. Yeah. So aortic murmurs will get louder with expiration. You have to ask the patient to sit, lean forward, and do expiration. How to ask the patient? Can you take breath in and out and hold? So he will say, and hold. So breathing in and out and hold. When he was leaning forward, okay, it will be louder here for aortic, okay. Regarding the mitral, if the examiner said, yes, there is palpable thrill, okay, there is palpable murmur in mitral area. It means the fifth intercostal space. So what you will do, you have to diagnose maybe mitral stenosis and maybe mitral what?
Regurgitation.
Regurgitation. So mitral murmurs will get louder with expiration. So you will ask, you will do, I'm talking about the examiner said, yes, there is murmur, palpable thrill in the fifth intercostal space. So verbalized to the examiner, it's mitral murmur. Okay. So what you will do auscultation by diaphragm and bell of stethoscope 2 times. Okay. How to understand it's mitral stenosis or mitral regurgitation? So
If
ask
you radiate,
the patient to do expiration. Okay. So can you take deep breath in and out and hold? But remember, after you finish, you can breathe now. Don't forget that, because he will stay holding his breath. Okay. So an expiration and the leaning on the left side. Okay. So auscultation of the axilla, listening for radiation, it will be mitral murmur. Okay. So which one, guys, will be radiated to the left axilla?
mitral stenosis.
Regurgitation.
Regurgitation. Okay. Yes. Okay. So yeah, here, guys, the most important to understand how to catch the station. Maybe you will watch this video in GK Medics 1 time, 2 times, 3 times, but you don't know how to get the diagnosis, how to catch the station, how to deal with the examiner. Okay. So you ask the examiner when you are doing thrill first. Okay. He will say, yes, there is palpable thrill in the mitral, in the fifth intercostal space. At that moment, verbalized to the examiner, the patient has mitral murmur. So you will do auscultation by diaphragm and bell of stethoscope and ask the examiner again, any murmur in the mitral by stethoscope? Maybe he will say yes. Okay. So ask the patient, can you lie on the left side? Okay. Keep the stethoscope and ask him to do expiration. Okay. Tell him, can you take deep breath in and out and hold it? Okay. So ask the examiner, is the murmur radiate to the axilla? Okay. If yes, it will be mitral regurgitation. After that, you can do the same. So check for sacral edema, lower back, check for pedal edema, both ankles. Here, it's not a big issue if you forget regarding signs of DVT. Okay, and no need until the patient has chest pain. If the patient has chest pain, do for signs of DVT. If he has palpitation or heart racing, no need for this one. After that, auscultation, bilateral basal crepitation, maybe a heart failure or maybe anything else. Okay, clear, guys? Okay. Anyone want to do this station again, or we can proceed for the next station?
I can try, Dr. Hani.
I can try also.
Okay, I think someone is new. Dr. Ihab?
Yes.
Okay, if you are happy to do that, it's okay. If you will ask me, I will answer you. If you did not ask me, I will not answer you, and you will not get any fine, right? Yeah. Okay. I will keep this one. Okay. Like that. Okay, you can start.
Okay, wash my hand, wear PPE. Hello, My name is Dr. Hab, one of ED doctor. Can I confirm your name and date of birth, please?
Yeah, I am Fathi. I'm 30 years.
Nice to meet you, Mr. Fathi. I have been told that you have heart racing today, so I need you. I will take some data from you, and I need to examine your chest. Is it okay with you?
Okay.
This involving me touching you, feeling you, and put a stethoscope on you. Is it okay with you?
Okay.
Okay, one of our nurses will be with us, if you don't mind. Okay.
Yeah. Okay. Okay.
So for the purpose of the examination, I need you to please to remove your top and lie over the couch.
Okay.
Okay. I will start my examination at the end of the bed, looking around the patient for any clue like sputum bulk or any oxygen cylinder. Generally, my patient looks well. I would like to examine the hand. Can you please put your hand in front of you, looking
Okay.
for any feature of infective endocarditis, like clubbing of finger? Can you put your hand like this
Okay.
for me? And looking for splinter hemorrhage, can you turn your hand over? So also looking for oscillatory nodes, genuine lesion, peripheral cyanosis, and I need to check for capillary refill time. And also I need to check for pulse rate, rhythm, and volume, ideally over 1 minute.
Okay.
Okay. And I will check for radioradial delay, sign of aortic dissection. Also, I would like to check for the blood pressure and collapsing pulse as well. Okay. Do you have any pain in your shoulder?
No.
Okay, I will raise your shoulder. Do you feel any pain? Okay. And also, I would like for this collapsing pulse, also sign of aortic rigor. Okay, now I would like please to turn your hand to the other side. I would like please to check your neck. Can you turn your head to other side?
Okay.
I will check for jugular venous pressure, visible, palpable, compressible, obliterated, and also for hepatojugular reflex, I will put my hand in your tummy. Do you have any tummy pain?
No.
Okay. Okay, looks normal. Can you please show me your eyes? I will look for pallor cyanosis, xanthelasma, corneal ulcus, feature of hyperlipidemia. Okay. Can you protrude your tongue outside, please?
Okay. Okay.
And turn up for your center cyanosis and oral hygiene. I will check for center cyanosis and oral hygiene. Okay, poor hygiene is also feature of infective endocarditis. Now I will let the bed down. Okay, I will let the bed flat. I will check the pericardium. Firstly, I will check by inspection if there is any sign of any surgical scar. I will check all the side. Okay, I will look for visible pulsation and center and contour if there is bulging in the contour. Okay. Okay. Then we'll check for palpation. I would like you to. I would like to feel your chest. I will check for any. I will firstly I will check the trachea. This is center. Is it central?
Yes.
Okay. The apex beat in the fifth intercostal space.
Okay.
Normal in character. Okay. Then I will check for any thrill for the four area, the aortic area and pulmonary area and the mitral area and the tricuspid area.
Yes, there is
thrill?
a palpable. Yes, there is a palpable thrill in the fifth intercostal space.
Okay, I will check for also
What does
for
it mean?
left wrist. There is mitral murmur.
Okay.
Okay, and also I would like to I would like to check for left peristernal heave, sign of right ventricular hypertrophy. Okay, there is a left peristernal heave.
No.
Okay, I would like to auscultate also. First heart sound, second heart sound, and added murmur. Okay, there is murmur.
Only on the fifth intercostal.
This systolic or diastolic? Huh? What? Pardon? Hello?
Yes.
Okay, with it is okay. What is the character of the murmur?
Yeah, it's in the fifth intercostal space. This is only information.
Okay, I will check over the root of the neck for any. I will check for the pulse and the aortic bruit as well.
Okay.
Firstly, I will check for the bruit in aortic bruit.
Thank you, Dr. Ihab. You have 30 seconds.
Okay, okay. I will help I will continue my examination. Also, I would like to.
Yeah, you are
I
doing
will.
well. Yeah, continue.
Okay, I will complete my examination. I would like to do peripheral vascular examination, and I will give you
No,
some time to.
you are now in you finished inspection, you finished palpation, you are now in auscultation, right?
Yes, in auscultation. Yes.
Yeah, continue auscultation. So you will do auscultation by diaphragm of stethoscope. After that, by bell of stethoscope for all valves, for four valves, right?
Yes, and for aortic bruit as well. So, and also I will like to check for pericardial friction rub. There is pericardial friction rub.
It's not important here.
Okay.
Regarding carotid berwi should be after brachial. So radial, after that the radioradial, after that brachial for collapsing pulse, after that carotid, right?
Oh yes, yes.
Carotid here it will be auscultation before feeling by bell of stethoscope. You finished already the peripheral vessels, peripheral pulses. After that, you go for central pulse. Central pulse here, I mean the heart, okay? Central, yeah, peripheral vascular examination and the central cardiovascular. So here's the heart. Already you finished inspection. Inspection, you are talking about scar. After that, palpation. Palpation, it means you will feel for parasternal heave. After that, thrill, right?
Yes.
For four valves. And already you felt the apex of the heart, fifth intercostal space. You did very well. Okay, you are very organized, but you missed carotid berwi should be after break. After that, you ask me any palpable cyril. I told you there is palpable cyril in the fifth intercostal space. You have to verbalize to the examiner so the patient has mitral murmur, right?
Yes, yes.
Okay, so what you will do, you have to do auscultation. Auscultation for mitral valve, tricuspid valve, and pulmonary valve and aortic valve by 2 times. The first time, diaphragm of a stethoscope. The second time will be with bell of a stethoscope. Okay.
Yes.
And ask the examiner again. Any mitral murmur by the auscultation? Yes. Okay. So until now, it's not clear mitral stenosis or mitral regurg. What you will ask the patient to do now, you can start.
I have one also one question here in this area. So if it's going through mitral valve problem, I will not ask the patient to sit and have deep breaths to check for aortic murmur, or I will continue.
Why I will examine for aorta? He said the palpable cyril here in the fifth intercostal space, right?
Yes, yes.
If you will do for all, it means you don't understand the station. Okay?
Okay.
Yeah. If he said the patient has palpable cyril in the second right intercostal space. What does it mean?
Right, this mitral.
Aortic valve.
Aortic murmur, right?
Yes, aortic.
So
Yes.
you will focus on the aortic area, right?
Yes.
Did you get my point?
Yes, I get your point. Very
Yeah.
clear.
Yeah. So this is how to catch the station. I want you guys how to catch the station, how to catch the diagnosis, how to save time in the exam, how to go to the point. Okay. It's not about doing the examination for everything. Okay. Like history taking. History taking the station, it's not talking about sexual history. Why I will talk about sexual history? Okay. It's not about scripture. Don't be scripted. Okay. So here already you ask the examiner with palpable thrill for 4 valves, mitral area, tricuspid area, aortic pulmonary area, and aortic area. Any palpable thrill? He said yes. Where? In the 5th intercostal space. So you have to interpret to the examiner. So the patient has mitral murmur. Until now, it's not clear. Here, if you will ask him about systolic or diastolic or band murmur,
Systolic.
yeah. So here he will not give you information. It will be clear if he will give you information, right? He want you to catch it by examination. They are testing your skills how to catch the station, right? So what you will do?
Okay, I completed my examination. I would like to do peripheral vascular examination. I will give
No, doctor. I am not asking about this point. Now you are in the station. Okay, you are in the middle of the station. You are not in the end of the station. You ask me where is the any palpable thrill? I said in the 5th intercostal space.
Yes. I after that I will do auscultation, also confirm the
Excellent. So I will do auscultation
Mm.
one time by diaphragm of a stethoscope, the other time by bell of a stethoscope for 4 valves, for mitral, for tricuspid, for pulmonary, and aortic. Okay, and ask the examiner again by auscultation any mitral murmur. He will say yes. Okay, so what you will do next?
So next I will
You will ask the patient to do what? Leaning forward or lie on the left side?
Lie on the left side, of course.
Lie on the left side, because we are talking about mitral. We are not talking about aorta, right?
Yes.
Yeah. So can you lie on the left side? And he will take expiration or inspiration?
Expiration.
Expiration. So can you take a deep breath in and out and hold it? Okay. So ask the examiner at that time, is the murmur radiated to the axilla? If yes, what is the diagnosis?
The axilla is
mitral regurg.
Okay. So ask the patient, you can breathe now. Okay. Yeah. I think it's clear now.
Yes.
Yeah. So after that, you finish already auscultation, you can continue your examination. So you can go for the back. After the anterior aspect, you can go for posterior aspect. So you can do auscultation also, and you can auscultation here will be bilateral basal crepitation. Check for bilateral basal crepitation. Check for lower back for sacral edema. After that, pedal edema. And if the patient has chest pain, not heart racing, you can check for signs of DVT for tenderness in the heart. Okay. Well done, Dr. Ihab. Amazing. Well done.
Thank you very much.
Yeah. Next station, who is happy to do?
Yes, I will do, Doctor.
Okay. So unlikely, maybe in the practice, the patient will get more than one murmur. But for the purpose of the exam, he will focus only on one murmur. Okay. Sometimes it's a normal examination. If you will ask the examiner any palpable thrill, he will say no. After that, in examination by auscultation, I will do auscultation by stethoscope, by diaphragm, and then by bellow stethoscope for mitral area, tricuspid area, pulmonary, and the aorta. Any murmur, he will say no. So it's a normal examination. Okay. Maybe they will save time. Okay. Next station, Dr. Abdullah Malik.
Yes, doctor.
You can start.
Good evening. I'm Dr. Abdullah Malik, one of the registrar. May I know your name and grade, please?
Yeah, I'm Dal, 34 years.
Nice to meet you, Mr. Dal. I have been informed that you have abdominal pain, and for that I will be going to examine you. Is it okay with you?
Yeah.
Do you have any pain now? Are you
Yeah, I
comfortable?
have been in the here in the right upper quadrant.
I'm sorry for that. Do you need any painkiller?
I took painkiller.
Okay, I need to just check vital signs. So, Mr. Dal, I will be going to examine you and to rule out what is the cause of your upper quadrant abdominal pain. And for this, it will be going to involve look, feel, and do some special tests for your tummy. And I want to expose your chest and tummy and lower legs as well. And we will be in a private room and one nurse to attend with us as a chaperone. Is it okay with you?
Okay.
Okay. So first of all, I will just be doing, we will be sitting comfortably on the 45-degree angle on a couch, and I will just do some general inspection regarding your hands. Can you do your hands in front of me? So I will just inspect for some failure or clubbing or pyronychia, and I will assess for flapping tremors or any signs of abdominal pathology. So can you do your hands like the other side? So I will expect for, yes, okay, so I will inspect for pallor and repeat transcontracture and also for erythema. Okay, so now I want to check for the pulse for you, for just for the radial pulse for rate, rhythm, and volume. And now I just want to do general inspection for your arms regarding any needle marks or any other bruises. So just can you put your hands behind your head? So I want to examine your axilla for any bruises or any pathology or any hair loss. Okay, so just can you straighten your arms, your hands for just for asterixis for flapping tremors. Okay, so now I want to examine your face and just for your eyes especially. Okay, yes. I want to check for the corneal arcus or gingival pallor or any erythema or any jaundice, especially below your eyes. Okay, so we'll just continue with my inspection for your mouth. Can you open your mouth, please? I will look for angular stomatitis or any oral candidiasis or anything, any inflammation on the tongue. Is there anything? Okay, now we'll proceed more for just for to check for the neck. We will do some just palpate for lymph nodes behind your neck and also on the especially on the supraclavicular area. Any findings? Okay, thank you. I want now to do general inspection for your abdomen. I will be standing on the head end of the bed and will do inspection for having to check for any masses, any swelling, any hernia, or any signs. Okay. Also, we'll do meanwhile we'll do inspection for the chest for any spider nevy or any breast atrophy or any loss of hair. Okay. Then we'll come again for the inspection of the abdomen, first from the head end of the bed, and to check for any masses or any distension or any visible pulsations or any hernia, any great Turner signs or any Cullen's signs in the flanks. Okay. So now I will be going to palpate your abdomen. First of all, I will do light palpation in the 9 abdominal regions, starting from right iliac fossa, and to assess for any tenderness, any guarding, any rigidity. Is there any finding? Okay.
Yeah, there is
So
discomfort when you are touching the right hypochondrium.
yes, okay. So I want to now depalpation from the same 9 abdominal regions from the right to the left iliac fossa, and now to check for any deep palpable masses or any thing. I want to do special palpation for abdominal organs. I will palpate for the liver, starting from the right iliac fossa. Can you take deep breath? And I will check for any hepatomegaly. Okay. Or then I will palpate from right iliac fossa towards left hypochondrium to look for splenomegaly. Okay. And then I will put my hand parallel to the midline, on the midline above the umbilicus to check for palpable aorta to rule out abdominal aortic aneurysm. Then I will do balloting of the kidneys for any ballotable kidneys or any to rule out any polycystic kidney disease. Okay, from the left side and also from the right side. Okay, now what to do for percussion? We'll first of all percuss the liver from the lower edge up to the from the right iliac fossa up to the right hypochondrium to assess for how many fingers breadth I can check there is a dull note starts appearing from resident. Okay, and also I want to check for staining borders by percussion from right iliac fossa again to the left hypochondrium. Also want to assess for shifting dullness or to rule out ascites, or can you turn to your left side, please? So we'll wait for 1 to 2 minutes and then we'll start percussion for the abdomen. And if the notes getting dull from resident, again to check for any ascites or any fluid accumulation. Okay, now I want to proceed for do auscultation for the abdomen. I will auscultate for bowel sounds. Okay, first of all, any finding? Okay, it's not any tinklings, bowel sound suggesting bowel obstruction, or absent bowel sounds suggesting paralytic ileus. Okay, so I want to proceed further for auscultation for aorta. It will be 2 centimeters above the umbilicus in the midline to check for aortic pulsation. Okay, auscultate with the diaphragm of the stethoscope, and then I will do auscultation for renal arteries for any renal bruit, 2 centimeters lateral to the midline from above the umbilicus to check for renal artery bruit. Okay, and then the last I want to check for any fluid accumulation, any pedal edema by compressing the calf muscles with the thumb. Is there any sacral
Thank you,
edema?
Dr. Abdul. Thank you.
Okay.
So,
Thank you.
what is the finding here?
The patient has, as you told me, has complaint of right upper abdominal pain. So I suspect most likely. Yes.
Any jaundice here?
Jaundice, I asked in the eyes inspection, but there is any jaundice when I asked you?
You did not ask me.
Okay, no, I remember for conjunctival failure and arcus and jaundice.
Here,
Okay.
arcus should be in heart examination, right?
Yes. Okay.
So if you ask me any jaundice, I will say yes. Okay. If the patient has jaundice here and the patient has right upper quadrant, did you ask this pain is continuous or on and off?
Yes, exactly. Because the same issue is that if the task is examination, so I don't
yes, but you have to ask the most relevant
should
question.
ask the brief history. Yeah, the most relevant question. Okay.
Yeah, most relevant question here.
Exactly. So to diagnose should be the most relevant questions, at least in the beginning. Yes.
Yeah. Here also the task is teaching. Okay. So you have to introduce yourself to the junior doctor, and you can tell the junior doctor, I am Dr.
Yeah, that's why in the beginning I asked for the name and grade. So I thought you will introduce as the doctor yourself.
Okay.
Then I will proceed for teaching. Yes.
Yeah. So you have to introduce yourself. I am Dr. Abdullah Malik. I'm the most senior here. I have been informed that you have one patient with abdominal pain, right? Yeah. So may I know your name and the grade, please? Blah, 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 blah. So for the purpose of teaching, you can watch me and I will examine the patient. So you can go for the patient and introduce yourself and go with him. So after that, you can ask the patient about the tummy pain, where exactly, where is the site, and is it on and off. Also, you have to check the temperature of the patient. So here in the end, if the patient has continuous pain and jaundice, so you have to do liver function test to rule out any hepatitis C or any hepatitis B or hepatitis A, and also to rule out ascending cholangitis. So you have to do virology as well. Okay, full blood count as well. Okay,
Yes.
the most important. You will see if you will need also tummy scan or not. Okay, so
Yes. Okay.
here this station, it's very easy and straightforward. Just be organized. And here in palpation, if the patient has tummy pain, so you have to verbalize to the examiner, I will do light palpation. After that, deep palpation. Or you can say, I will look at the eyes of the patient for any tenderness. I will check for any masses, for any hernia, and also I will check for tenderness looking at the eyes of the patient. Once you will touch the area of the pain, you will find he has discomfort. Clear, Dr. Abdullah?
Yes, doctor. Yes.
Yeah. Okay, so you have to show empathy. I'm sorry. Would you like me to give you painkiller? He will say it's okay or anything. Okay, well done, Dr. Abdullah.
Yes.
Okay,
Thank you very much.
well done. Okay. Guys, we will stop here because it's already 9:20. Okay. We still have one station for vaginal examination. Anyone want to do?
I can do.
I can do.
Okay, Dr. Ahmed Al-Amin.
Okay.
Okay. So this station of vaginal examination, it can come as three types. One type is foreign body. You will ask here, how can I help you? She will say, I came here to remove foreign body in my vagina. And maybe she will say, I have vaginal bleeding. Maybe she will say, so it's three types, maybe vaginal bleeding, maybe vaginal tear, maybe inside the vagina. So you will take a brief history. Don't waste the time, Dr. Ahmed, in history. The most important here, last sexual act, last ministerial period. Also, was it protected or not? It means was she using a condom or not? Okay, and what her concern? So ask about eyes from the start. So brief history, not more than 20 or 30 seconds. Number two, eyes. Okay, and her eyes, maybe I want to remove the condom. Her eyes, I have vaginal bleeding. Okay, so vaginal bleeding here. Do you still have vaginal bleeding? And also no need to assess the bleeding. The bleeding should be in examination. To assess the bleeding in examination. Okay, in vaginal tear you will find in examination. So you have to ask the examiner clearly on an inspection. Any vaginal bleeding, any vaginal tear. Okay, so two questions to the examiner, very, very important to understand the stage. Okay, clear, Dr. Ahmed?
Yes, Dr.
You have two stages, two examination. One stage or one examination with bimanual examination. If you can find your two fingers inside the vagina, so ask the examiner clearly, can I feel the condom by my fingers? If she said yes, can I remove the condom by my finger? And also sometimes they put the condom in the mannequin. Okay, so if you find the mannequin like that and your finger inside, if you find the condom by 2 fingers, you can remove by 2 fingers. Clear, Dr. Ahmed?
Yes, Dr. Han.
Yeah. And if you don't find by 2 fingers, you have to continue by speculum examination. You will find by speculum examination and you can remove. After that, you have to show the patient the foreign body. Don't remove the foreign body without telling the patient. No. Yeah. I have good news for you. I removed the condom and can you see that? Okay, done. Okay. So take care. Don't make pain for the patient. Confidentiality, privacy, these marks for you, okay, and also dignity for the patient, okay, and the clear explanation for the patient. Okay, you can start, Dr. Ahmed.
Okay, I'm going to wash my hand, put on my PPE. Hello, I am Dr. Ahmed Al-Amin, ED Registrar. May I confirm your name and your age, please?
Yeah, I'm Karima. I'm 24.
Nice to meet you, Mrs. Karima. Mrs. Karima, I have been informed that you have a foreign body in your vagina, a condom. Is this correct?
Yeah, it's okay.
Oh, I'm so sorry to hear that. Okay, so let me move you to a private room and one nurse will attend with us as a chaperone. Would that be okay?
Yeah, please.
Okay, are you having any pain right now? Can I offer you any pain medications?
I'm okay.
Okay, Ms. Karima. So I would like to take some data from you, and also I would like to do an examination for your vagina. This will involve me putting 2 fingers inside your vagina, pressing over your lower tummy. After that, I'm going to use a certain device called the speculum in order to be able to see the condom and examine the inside of your vagina. A kind of examination that can be uncomfortable, but it won't be painful. Is this okay for you?
Yeah.
Okay, the nurse, the chaperone nurse will be attending with us. Okay, let me first check your vital signs. Ms. Karima, do you have any allergies, any medications you are taking?
No.
Okay, Ms. Karima, this sexual intercourse, when did it happen?
It was 3 days ago.
Is it your regular partner or another?
Yeah, regular partner.
Okay, when was your last menstrual period?
It was like 2 weeks ago.
Okay, and is your regular partner having any history of any sexually transmitted disease or any problem?
No.
Okay, so what are your concerns, Mrs. Karima?
Yeah, I want to remove this condom, and also I don't know this will affect me regarding sexual transmitted infection or pregnancy or what, because the condom was removed.
Okay. Yes, your concern is appreciated. Let me first do the examination for you, then I'm going to discuss with you everything. Okay, so Mrs. Karima, I'm going now to prepare my equipment. I need you to lie down on this bed. Sorry, first of all, I need you to go to the bathroom, empty your bladder. After that, behind the curtain, you can take off your underwear, lie down on the bed. I need you to bring your heels up as far as you can and spread your legs apart and then cover yourself while I'm bringing my equipment. I'm going to bring gloves, KY gel, vaginal speculum, also forceps. Okay, Miss, I'm coming back. The chaperone is with me. Mrs. Karima, are you ready for the examination?
Yeah.
Okay. Ms. Karima, I'm now going to expose. First, I'm going to start by inspection. I'm looking for any discharge, for any bleeding, for any ulceration, for any skin changes. Ms. Karima, can you please cough? Okay, either any vaginal prolapse. Okay, Ms. Karima, I will start now by examination. I'm putting on my gloves. I put KY gel. I'm going to spread the labia by the left hand. Ms. Karima, I'm going to insert 2 fingers now inside your vagina. Okay, I'm going inside the vagina. I'm feeling the posterior vaginal fornix for any pain, tenderness, any masses, the lateral vaginal fornices, and then the anterior vaginal fornix. Okay, either any tenderness, any masses, any pain. Can I feel the condom itself? Okay. Now I'm going to feel for the neck of your womb. Okay, I will feel for the consistency, for any tenderness, and for the position. Ms. Karima, now I would like to do a pressure over your lower tummy so I can feel your womb. I'm going to feel the uterus for any tenderness and for any the consistency, and I'm going to feel through the lateral fornices bilaterally also the right and left iliac fossa for any pulsating masses or any tenderness for the ovaries and the tube. Okay, now Ms. Karima, I am going to remove my hand, okay? Ms. Karima, now I'm going to put this speculum inside your vagina, okay? So I'm going to lubricate the speculum, again, separate the labia, and go with the speculum in a vertical position. As I'm inside, I'm going to rotate it to 90 degrees and I'm going to lock it. Okay, I'm going to look inside to see if the position of the cervix and any discharge, as well as the condom. Can I see the condom?
Yes.
Okay, I'm going to remove the condom using the forceps. Okay, Ms. Karima, I have removed, this is the condom. I'm going to dispose it. Is it okay? Now, Ms. Karima, I'm going to remove the vaginal speculum. So I'm going to loosen the lock of the vaginal speculum and draw it out carefully, making sure that I don't cause any pain to the patient. Okay, Ms. Karima, allow me please to clean any KY gel. I'm going to cover you now. Ms. Karima, I'm going to wait outside to discuss with you. The nurse will be here if you wish her to help you in dressing. Would that be okay? Okay, I'm going to dispose all my equipments and PPE. I'll wait for Ms. Karima outside when she comes. Ms. Karima, we have removed the condom from you. However, now if there is a suspicion for pregnancy or the possibility of pregnancy, we need to give you a morning after pill, 1 tablet for your protection. Also regarding the post-exposure prophylaxis, about sexually transmitted diseases, as you are saying that this was your regular partner, so we are not suspecting sexually transmitted diseases. Otherwise, we would have given you a post-exposure prophylaxis of tablets for 28 days. Is this clear for you, Ms. Karima?
Yeah, clear.
Do you have any further questions for me you want to ask? Okay, thank you very much. I wash my hands.
Okay. Excellent, Dr. Ahmed. What do you think?
I don't know. I practiced this station, but long time ago, but I don't know if I completed the points or not. So,
okay. Anyone want to add anything, guys?
Excellent. MashaAllah.
Okay. Anyone want to add anything?
Yes, Dr. Hani, very nice, but only for high vaginal swab, we will ask for in the last when we remove the condom.
Okay, this 1 point. What else?
During bimanual the examination, if I feel the condom while I do manual examination, could I remove it? I think Dr. Ahmed didn't ask for that.
Yes, here in the exam, you will feel by 2 fingers because it will be inside the mannequin. Okay, they will put inside the mannequin. If you feel the condom, you can remove. Okay, you can.
I asked if the condom, if I can feel the condom, but the thing that I forget also.
You can ask me. You can ask me because you cannot feel. Did you get my point? Okay.
Yes.
But in the exam, you can feel because you will put your finger inside the mannequin. Did you get my point?
Yes, Dr.
So in the exam, no need to ask the examiner. In the exam, you can verbalize. Now I can feel the condom and I will remove. Can you see, Mrs. Karima? I removed it. Okay. Did you get my point?
Yes, Dr.
Yeah. And if you cannot remove by manual examination, so once you insert the speculum and you can use the forceps, so I can see the condom now, I will remove by forceps. After you remove, I removed the Miss Karima, okay? And so on. Okay, here I have only 1 point. So you did very well, amazing, okay? Here regarding the speculum, you did very well also. Regarding the inspection, you can ask the examiner about bleeding and tear, okay? Any vaginal bleeding, any discharge, any tear. And here also you suggest for the patient morning after pill, right?
Yes, because it was 3 days, I think.
Okay,
Said,
did you ask here, are you trying to get pregnant?
that it was in the concern. She was I think there was
Concern,
something about pregnancy.
I want to see if I am pregnant or not, but you have to ask her clearly. Are you trying to get pregnant? Okay.
Yes.
If she said, yes, I am trying to get pregnant, it's okay. Okay. So, or you can ask her clearly. So, would you like to get pregnant or not? If yes, so
But maybe
would you like
because
me
she
to
was
perform-
doing the intercourse with condom, so maybe she doesn't want to get pregnant.
But you have to confirm. You have to
Oh,
confirm.
okay, Dr.
Okay.
Yes, yes. Okay.
Okay. So you did very well. And here you have to expose all equipment. And already you did very well in examination. And regarding the examination, I like when you said, I will do on both sides. It's good to save time. Okay. So, and by manual examination. So when you remove your hand, also verbalize any discharge or any bleeding in my fingers. Clear, Dr. Ahmed?
Yes, Dr. Han.
Yeah, this is also important. Okay, because sometimes you cannot see, but when you remove your hand, you will see if you have any discharge or any bleeding. Okay, after that, as you did, so it will be just ask here, would you like me to take a swab for your cervix, from your cervix? Okay. If she said yes, you can take, but don't take a swab without consent, right? Okay.
Okay, Dr. Han. Yes.
Yeah, well done, Dr. Ahmed. So I think don't forget dispose all equipment. Don't forget confidentiality, privacy, chaperone. You have to mention by name. Would you like one nurse attend with us as a chaperone? Okay, very, very important. Okay, well done. I think we finished, guys. Okay, so I will mention the next decision on the group, inshallah. Okay, bye-bye, guys.
No class
Thank you,
tomorrow.
Dr. Han. Bye.
We will mention in the
thanks.
group.
Okay.
Okay, thank you, guys. Bye.
Bye.
Thank you.